Thank you. Thank you, Dr. Satish. Welcoming everyone on today is a morning. Happy Makar Sankranti, happy Uttarayan, and any other festivals that you are celebrating. And thank you for giving us your time today. 𝘃𝐿𝑖, over to you to welcome everyone.
Let us wait for just 1 minute more so that everyone join.
Yeah. Quickly, I'll sum up the last day. We went through insights from speakers on various therapy areas regarding diabetes, acid peptic disease, and arthritis. Insightful discussions and the challenges that pharma industry faces today regarding patient centricity. That was also discussed. In case you have missed it, it is there at our channels live, and it will be there at Pharma State Academy in shorter form also. So we will update you regarding that, and thank you for joining yesterday. And now for today, we are hosting wonderful students and wonderful faculty members today from various institutions across India, from 𝘲𝑚𝑎𝑛𝑔𝑚, especially thanking students and faculty from 𝘲𝑚𝑎𝑛𝑔𝑚 Institute of Management Studies, and also from Jamia Hamdard, from Pune College, and many professionals also who are joining the faculty discussions today. Thank you for joining us. And over to 𝘃𝐿𝑖, project manager at Pharma State. She will be the host and moderator for today. And best of luck, 𝘃𝐿𝑖. Let's do it.
Thank you, Dr. Swati. I hope I will do justice to the responsibility given to me. So hello and welcome everyone to the World Pharma Brand Managers Day 2023, Day 2. And a very warm good morning to one and all present here. I hope you all are having a great weekend. First of all, I would like to thank each one of you for gracing us with your presence today. And before we begin, I hope you all had a great start to the new year 2023. And now that we are all done with the new year parties, I would like to take this opportunity to invite you all to enjoy the learners party. And let's share the enthusiasm with a video. Let's get the learners party started. Okay, so with that shared fervor and enthusiasm, let us now move forward with this wonderful exposition of knowledge and ideas with some amazing students, expert and senior dignitaries from the pharmaceutical academia and industry. I, Gauri Kumari, is going to be your host for the day and the moderator, and I hope I'll be able to do justice to the responsibility given to me. And the moderation for the best in pharmaceutical academia and industry. This year, we have a theme of patient centricity, which has become the talk of the town in the pharmaceutical industry and is extremely important to achieve excellence in pharma marketing. One needs to understand the pain points of patients and what struggles they go through during their journey in order to serve them better. Let's learn more as we go ahead. Can we have a brief introduction of what we are going to talk about today in the form of a video? with that wonderful introduction, I welcome all our esteemed panelists for the day. And I can see many familiar faces here, and I believe the beginning is going great. Okay.
𝘿𝑚𝑖, just give me one moment
Sure.
to thank, first of all, the team who has done the brilliant work, and also thank the dignitaries for joining us today. We also have Dr. Sanjay Mitra with us, and along with Anish, who would be speaking, and Dr. Manjuri and Madhulina also. Welcome to all three of them, all four of them rather. And thank you, 𝘗𝗲𝙗, for being the mentor for the students, and even at Pharma State Academy, you have been brilliant, and without you, this day was not possible. Thanking Vivek sir, and obviously our team, Shazia, Gauravi. Over to you, Gauravi.
Thank you so much, Dr. Swati. Okay, so as we all know, we have gathered here today to commemorate the legacy of late Professor Chitta Mitra, who is also known as the father of Indian pharma brand management, and whose contribution will always be remembered and celebrated. To begin with, allow me to introduce our very first speaker for the day, Mr. Anish Mitra. Mr. Anish is the Vice President of Strategy at SMSRC and Group companies, Medclin and Medsign. Mr. Anish is responsible for strategy and operations related to the group's endeavor to become a globally leading clinical intelligence company with existing and newer services. Anish has around 10 years of experience now across SMSRC and Group, Abbott and Credit Suisse. He is an economics graduate, a postgraduate in financial economics, and is currently pursuing an MBA from ISB. Besides clinical intelligence, he loves playing the piano and exploring nature, and is a passionate sports fan. Thank you, Mr. Anish, for joining us here today. Over to you.
Thank you, Gauravi, for the wonderful introduction, and thank you, Dr. Swati and Vivek sir and the entire Pharma State Academy for inviting me. Let me just share my screen. Is my screen visible, Gauri?
Yes, it is.
So thank you, Pharma State Academy, for inviting me, and warm welcome to everyone. Happy New Year. Happy Makkar Sankranti to everyone joining us from India and Bangladesh. Hope you're doing well, and wishing you good health for the new year. Having said that, I'd like to start my short speech or discussion on how prescription data can be leveraged for a patient-centric approach in pharma marketing by pharma marketeers. And keeping this in mind, I think I'd like to start my discussion today. Before I start anything, I think the reason why we are having this Global Pharma Brand Managers Day is to celebrate and pay our respects to Professor Chitta Mitra on this day, on 3rd of January, when he left Earth. And he's also known as the father of pharma brand management, as nicely done by Pharma State Academy over the last 2 to 3 years, and even more. I think this occasion is a grand celebration of all the work that he has done throughout his life to celebrate how ethical marketing should be done in the right manner using prescription data. And being an advocate and pioneer of the same, I think what Pharma State Academy is doing is wonderful. So before I start, I'd like to give a little brief, I think, for the attendees who have joined us today. So Professor Chitta Mitra is the founder of prescription-based market research in the world, along with his friend, legendary Dr. Tarun Gupta, who was the head of marketing at Glaxo in India, now known as GSK. Everyone, I think, in pharma industry in India and Bangladesh, and even in the world, probably just know both of them by name. And the work that they have done has been so instrumental that even today, when we're sitting in 2022, we're still talking about it. And it's at the center of what every pharma marketing professional is still doing in their offices in Bombay or in Hyderabad or in Ahmedabad or wherever in India or in Bangladesh. So the primary objective behind initiating this service from Professor Chitta Mitra was to help pharmaceutical companies ethically promote their offerings to doctors. At a time, imagine in 1970s, when the D of data was still not known, because technology is not what it is in 2022. It was not the same in the 1970s. So I think to think about utilizing data, capturing data manually at that time to improve patient healthcare outcomes eventually. And I think that's the entire focus behind any stakeholder in healthcare, to improve patient healthcare outcomes. Everything else is a process which eventually helps improve patient healthcare outcomes. And what he did back then in 1970s is still being utilized today as a critical tool by the pharma industry, and pharma marketeers especially, in terms of how they can improve the scientific offering to doctors and make it more patient-centric. The service was initially conceptualized and initiated by him in 1977. And at that time, he was still a professor of marketing at IIM Calcutta. And he worked also in multiple reputed companies such as JWT, the advertising company, HTA, Hindustan Thompson Associates. And he was also credited for starting IMRB, the first independent market research organization in India focusing on consumer behavior research. So given his prior commitments, about 6 years was the gestation period until 1983, when this became a full-fledged company and organization that he started, and that is well documented and well known by everyone. So just generally, when I introduce myself, I speak about my background, but I think given this day and given the emotion of this day, I'd also like to say that he may be the father of pharma brand marketing, but he's also my direct grandfather. And I've been influenced and inspired in my life by him. What I am today is certainly because of him and my parents. So this topic, we are talking about a patient-centric approach. So without looking at anything, I think it's very clear to know that patient-centric, simply without looking anywhere, looking at any article, patient-centric clearly means keeping the patient in focus. So an approach which basically keeps the patient in focus is known widely as a patient-centric approach. As I've mentioned, keeping the patient as the focus by trying to understand their needs better and facilitate a smoother healthcare journey for the patient is a patient-centric approach. How do we understand their needs? One is if the patient tells me, one is by observing the patient. And in today's world, there are multiple ways to do that. If the patient articulates it through a survey, through an interaction in the doctor's clinic, through a private fixed group discussion, that is one way of understanding the patient's need. The other is if the patient is unarticulated, it's a latent need, which we can also observe today by analyzing patient searches or queries on Google. Looking at that kind of data, and Google Analytics will also tell us what is that latent need patients have in today's day and age. There are multiple such examples and processes to identify patient need and facilitate a smoother healthcare journey for the patient. This has been the endeavor throughout, but the ways and processes to identify the patient need have improved, increased due to technology, due to the advent of technology. And that's why today every single healthcare company, be it pharma, be it a health tech startup, at their end game, whatever they might be doing today, is all geared towards improving the health outcome of a patient. And that's why it's a patient-centric approach. Someone might be delivering medicines today through an online app. Someone might be doing diagnostic tests, but everyone is still involved in improving patient healthcare outcomes. However, being a stakeholder in this very sensitive, very important, very critical field from the respect of a patient, compliance comes into picture. And from a pharma marketeer perspective, it's important, yes, as an important member of the healthcare ecosystem, a pharmaceutical company has an important role to play here. But it's also important to be cognizant of compliance, because what a doctor can tell a patient, only a doctor can tell a patient. There's a qualification, there's a certain process involved there for a person to go through to achieve that kind of domain knowledge, to be able to tell the patient, you have this medicine for these days at this time, etc., etc. For someone else to do that directly is not deemed compliant. And that is the underlying caveat, I think, or the underlying risk everyone faces in trying to be patient-centric without being compliant to the rules and regulations. So how has pharma now, having understood what is patient centricity and how the ecosystem is evolving now, how has pharma been patient-centric? Before we go into how pharma has been patient-centric, let's look at the funnel, the patient funnel, which most of us would be aware of, but since most of us are students, I think I would just like to revise it once with all of you. Awareness. So the first part of the patient funnel starts with awareness, where patients become aware of different disease conditions. Prevalence. Post-awareness, patients undergo screening health checkups. So I become aware of a certain disease through advertisements, through social media, marketing. And then I realize, okay, if these type of symptoms or these type of conditions appear, I should go for a test. I should go for a test. And that's how a patient from awareness moves into prevalence, because prevalence is after doing the test, patients are detected. They see that, okay, the test results are not very encouraging. There might be chances that I have the disease. And a subset of the larger patients move into prevalence. And then comes the time to go to doctors, where the diagnosis and treatment happens. Where, as I said, qualified physicians diagnose and treat the patients based on the test results, based on the screening of an HbA1c, of a glucose test. A doctor might say that you have been diagnosed with diabetes, and then it becomes a chronic life disease. Once you're diagnosed with chronic diseases, they never go away, right? So then the aspect of compliance comes, where a patient needs to adhere to the physician's treatment. And this is, as you can see, the entire funnel is narrowing down, because at every stage, there's a dropout. And I think we can all easily relate where we see our family members sometimes missing medicines despite having certain chronic diseases, which they are supposed to take the medicines every single day. And that is the compliance part, where human tendency is to forget. If there is no fire on an everyday basis, I will not try to extinguish the fire. So no one is really thinking long-term about the repercussions that happen to their health by skipping a medicine today. And that discipline is inherent problem in every single human being. It's human nature. And that is why compliance is also a problem. So if you look at this entire funnel, it just keeps on narrowing down because there's a drop at every single stage. And the challenge is to increase the funnel size and make, by starting at making more and more people aware of different diseases and conditions and so on. And this entire journey that a patient needs to take, imagine diabetes, from becoming aware of such a disease in rural India. Maybe all of us in Dhaka, in Chittagong, in Calcutta, in Bombay are aware of diabetes, but in rural India, in the interiors, in Bangladesh, people will not be aware of diabetes. So making them aware, increasing the size of the funnel and making them go through the entire journey of screening, diagnosis, treatment, compliance, and being compliant is very important to improve their healthcare outcomes. And it has been seen, if a patient is compliant and this entire journey of a diabetic patient is facilitated well, the patient's chances of living longer and living a healthier life increases drastically. So the value that you attach to life is immeasurable. So from a pharma perspective, keeping this patient funnel in mind, that's where everyone in the healthcare ecosystem is really focusing on, to add value in some part of this process. E-pharmacy will come in compliance. Diagnosis and treatment in the doctor's clinic, multiple activities happen. So in different parts of the funnel, across the funnel, various integrated or horizontal approaches are taking place. And from a pharma perspective, how do we keep this patient-centric approach? And as a trusted stakeholder in the healthcare ecosystem, the pharma company behind a product or a brand can add further value to the patients, definitely by smoothing their healthcare journey from awareness, prevalence to compliance. Not only just giving a pill. So pill plus solutions is the language that is being used. Patient centricity is the language that is being used very commonly. And that involves facilitating the entire patient's journey. Keeping this background in mind, what are the various opportunities and some examples across each stage? So in awareness, it is important that patients receive reliable information. People receive reliable information to consume, understand, and act. Not patients yet, people, sorry. And There are various means to do it: advertisements on TV, leaflets in interior places, social media marketing, and so on. Because it's seen that 80% people today research about their healthcare before embarking on the journey. So they use Google. So and Google has many conflicting articles on the same topic. So a person can get very confused. So how, as a pharma company or as a pharma marketer in a disease indication therapy area I'm operating in with my brands, how do I create a portal of reliability and solid information related to my disease area? So all patients who have, say, a thyroid problem, they come to my portal only. Then comes the next part of the funnel, where how do I create community camps that conduct and facilitate screening and detection for patients. Also home kits, wearables, like your watches, smartwatches, your fitness watches. These all help in understanding, tracking vitals, and coming up with screening and health conditions subsequently. So how can I create such initiatives as a pharma marketer for my disease area, which surrounds my brand, is also an option, an opportunity. Then comes where the pharma company is already very strong at, in diagnosis and treatment, where addressing the right physician needs at the right time with appropriate products. So how does a doctor get the right product to offer to their patients? All doctors, let us assume, are rational human beings. It's a very fair assumption to make. And doctors will, as a rational human being, and then being a doctor, the doctor's duty means to keep patient first. The doctor's work involves keeping the patient-centric, keeping a patient-centric approach, because the doctor wants the patient's health to improve. And that's what the doctor is doing. So how do I keep that in mind as a pharma marketer and give the doctor the right tools, the right pills, the right solutions, basically, to help the patient at the right time? And then once the patient leaves the clinic, the challenge comes with respect to compliance. And compliance rates are very poor across life-threatening diseases. And how, as a pharma company, can I help patients becoming more compliant through reminders, home delivery of medicines? If I see in my specific therapy area that the patient is going to the hospital very often, how do I keep a taxi service? So there are various opportunities as a pharma marketer across these stages of the funnel. And there are various companies taking various initiatives in therapy areas, creating for underlying big brands. Some examples you would know are like Abbott's Theranorm, what Cipla has done in inhalation therapy. And connecting this patient-centric approach of a pharma marketer with prescription data, given that's the topic I will be speaking about today. And how does the prescription data analysis help a pharma marketer or equip a pharma marketer in facilitating this patient centricity? So a prescription reflects the mind of a physician, and a prescription analysis then helps in understanding the aspiration of a doctor towards improving the well-being of his or her patient. As we assumed, every human being is a rational person, and this is the truth. Broad majority of doctors want to help their patients improve the healthcare outcomes. If the doctor is patient-centric, the prescription will obviously reflect the doctor's aspiration towards improving the healthcare outcome of the patient. And accordingly, this analysis helps the pharma marketing professional curate relevant therapy management solutions to the doctor that are patient-centric. And how do we come in? What do we do? I think Gauri's introduction about me suggested that I'm from SMSRC, Medical in Medicine, where we are leaders in addressing clinical intelligence needs of the healthcare industry, leveraging on prescription data, which Professor Chitta Mitra started. We have been advocating the same application of that in various other ways, led by Dr. Sanjay Mitra, Dr. Manjuri Mitra. And so there are three companies. SMSRC basically does prescription data-based market research and consulting for the pharma industry in India and Bangladesh. MedClin is a CRO, a clinical research organization, and MedSign provides integrated patient management software that improves access to health records and enhances the continuity of care, the compliance part of it. And A brief background is that we have been in this space of utilizing prescription data and interpreting it, not only capturing it, modeling it, or even inciting that entire value chain of prescription data analytics. We have been present for 35 years, and that has given us a good amount of integrity, trust and respect from the industry. Inherent to our service is also excellence, customer excellence, and integrity. Expertise in the application has been our domain and been our strength, and also backed by technology-based pioneering systems and processes across 1970s. Every innovation cycle of 7 years, we have been focused on making new technological changes in our systems to improve the quality of the service. And given this experience, given where I come from, being involved in strategy and operations of the entire group and specifically operations of SMS-RC, I'd like to highlight some examples of how the service of prescription data across these three companies, which are three perspectives. One is real world evidence for application in marketing and sales strategy. One is application of real world evidence for clinical research, that is MedClin, and one is application of real world evidence for the doctor and patient through a software, through an application. How does these three help in a patient-centric approach, which can be leveraged by the pharma marketer, is what I'll highlight on. SMS-RC, as most of us would know, is a systematic, unbiased periodical feedback that is continuously provided to the pharma industry, where we are collecting prescription data from a large sample of 10,000 doctors in India and 400 doctors in Bangladesh. It's a stratified sample across regions, across doctor segments. And this is basically a qualitative feedback. A prescription is a qualitative feedback which becomes a which comes from a quantitative prescription data analysis. So the inciting is the qualitative part, the prescription data is the quantitative part that comes to the pharma marketeers in India and Bangladesh. And that provides actionable insights from strategic prescription research. And pharma marketeers today are using it for making better business plans, brand level strategy, product portfolio level strategy, company level strategy, M&A, and various sales, division-wise sales strategies also are formulated based on what the doctor wants and needs. And a case study or an example from SMS-RC in respect to the application of prescription research in providing a patient-centric solution for COPD asthma management. As I mentioned, Cipla has been a pioneer in this space. How would a typical Cipla marketeer go about utilizing prescription data analytics? I'll explain that. I think there will be multiple talks on how Cipla has actually done that, but I'll explain the process a bit and how prescription data connects. Is first would be an RX analysis is first done by the marketeers to understand which segment of doctors prescribe what dosage duration of product or brand to what patient segment for what indication. It helps. It is a starting point. The prescription data becomes a starting point of understanding what is happening in the doctor's clinic, what type of doctors are thinking of what type of segments of patients, male, female, age, demographics of the patient, which type of area, what are the indications or symptoms that are coming on the prescription, cough, breathlessness, when is the doctor diagnosing asthma, what is the preclude before that. This helps create a baseline because this input is coming from a qualified medical professional who is best equipped to be patient-centric, because that person is qualified. This becomes a baseline for any pharma marketeer to understand where to start and research further. And from a Cipla perspective, this would help them understand, okay, chest physicians are diagnosing such patients in such age ranges when they have such indications and giving them these medicines. And these patients are coming back regularly. Are these medicines helping enough? And that is where the innovation happens in the pharma marketing and the pharma company, where they keep on innovating on the technology of the offering that they can give to the doctor so that the doctor can provide something better. They will see that, okay, this patient, for example, is coming back regularly. How do I give a solution which is easy for the patient to intake versus something which is very complex? And to make it convenient for the patient. If I have a lifelong lifestyle disease, I would want to intake or input a medicine which is easy, not something which is cumbersome. And I like pricking. I don't like pricking. Anyone would not like pricking. So how can I make it convenient through a just a Velcro patch, for example. And in this case study, what we all know, you can see over here, this is just one analytical highlight that we have shown here of the IPM, the Indian pharma market, and 𝘂𝑝LA, how prescription distribution of the inhalation market between DPI and metered dose inhalers has evolved amongst chest physicians. And briefly, I'll just mention that, and we have shown over here in the IPM, basically, initially it was DPI more, and then both DPI has also maintained, but MDI has increased its share, and 𝘂𝑝LA has followed that kind of DPI, MDI share evolution also since 2016 to 22. We are just looking at 5 years, but if I take you back about 30 years when, or 25 to 30 years when 𝘂𝑝LA launched, started, they innovated by understanding what is happening in the market. They realized there is no solution, real solution to help COPD asthma patients, and they came up with inhalers. The entire concept of inhalers, the commitment to patients, the excellence that 𝘂𝑝LA showed to patients was unparalleled. And they removed asthma management using inhalers as a taboo. And the way they did that was through various patient-centric approaches. There was no technology back then, but just by speaking to the patient, you cannot be more patient-centric. Technology helps facilitate and make that process easier, but they put people who will speak to patients in clinics, explain to doctors, teach patients how to use inhalers, and they remove the taboo of using a DPI. So DPI is basically a powdered inhaler, and so that's how DPI came into first-line treatment for asthma management patients. And as you can see over here, MDI has taken up more of that share, which is a lighter blue line in the IPM and dominated by 𝘂𝑝LA. Both show the same trend. MDI is the dry powder created some itchiness or roughness in the throat. So they tried to make it more convenient, and that is where the metered dose inhalers came into picture. And why did DPI to MDI shift even happen? Because they kept on researching, innovating based on the baseline understanding of what is happening in the clinics today, in the patients today with COPD and asthma, and tried to make their product and offering to the doctors more and more patient-centric and convenient for the patient. The MDIs, every patient who has used both the DPI and MDI would say MDI is more convenient. And yes, if I have to take a medicine every single day of my life, I would want to take something which is convenient. Then automatically I become more compliant and I improve my healthcare outcome. Keeping that in mind, as an application of prescription research, if we look at 𝑚edClin, which is clinical research.
Anish, sorry for interrupting in between. We are over the time. Please take the last 2 minutes to complete this.
Sure. So if I look at 𝑚edClin, in terms of 𝑚edClin, patient-reported outcomes is beyond prescription data. Patient-reported outcomes is another application of using patient intelligence to help in facilitating a patient-centric approach from a pharma marketeer perspective. So this is a group of patients suffering from throat pain, infection, fever, cough. There's a randomized manner of putting them into 3 groups, and the doctor prescribes them A, B, C for the management of pharyngitis and gives them 3 antibiotics, A, B, and C. The patients are then given a questionnaire to fill up. So prescription data is captured from these 3 groups, but a patient is given a prescription questionnaire to fill up a subjective and objective feeling and experience of how they feel after taking the antibiotic. Both prescription and this PROC data, the questionnaire data, is then analyzed and helps the pharma company come up with a solution which is, again, patient-centric, which they can offer to the doctor. And my last example and last slide is on how patient management software and tech tools provide multiple new touch points to leverage upon in becoming more patient-centric. And in the case of MedSign, we are providing doctors, for example, with videos and pictures to explain and counsel to their patients so that the patients understand how to manage the disease better. So it's actually going as an attachment in the prescription. Patients are getting reminders for their prescriptions, for their medicines, automated reminders for follow-up visits to become more compliant. And that is how the power of technology also helps facilitate a patient-centric approach to the doctor. And this provides also multiple opportunities for the pharma companies to seek such tie-ups or such partnerships with health tech companies who are being patient-centric. Having said that, I think I am done with my discussion. I hope it was helpful.
Wow, wonderful, Anish. Thank you for showing us all the parts of it, the capturing the prescriber's perspective, capturing a patient's perspective, and capturing the IT part also. That was really, really good. And thank you for being here and giving the insights to the participants today. Thank you so much, Anish. Yeah, over to you, Gauravi.
Thank you.
Shankar sir, you would like to interact? Yeah, please, Satish, if Shankar sir can unmute.
Yeah, I just want to add, since Anish mentioned about the prescription research and many are participating here are students. Okay, be it Professor Mitra or the organization that are doing prescription research, one aspect that they always insist, and I have found in my brand management days very, very useful insight is, do not use the technical language which doctors study in their curriculum, but use the patient language. I think it was, means I'm talking about 25 years ago, this patient centricity, Professor Mitra or Sanjay Mitra used to talk about. An example is, instead of using the term pruritus, use the term itching. So this is what they used to advocate while printing communication material. I think this is this type of insights is what is going to help for a pharma marketer to go closer to the patient. Instead of sticking to the medical literature or terminologies, how do you speak the patient language, which the doctor, patient after patient, is listening, as well as he will be using the same language. So that synchronization of what patient speaks, use the same language, is one of the important contribution which has come from Professor Mitra. This is the point I wanted to make.
Thank you, Shankar sir. And this was the pain that we mentioned in last day also, that please speak the language of patients if you are actually wanting to help the patients. Thank you so much, Shankar sir. Gauravi, over to you to start the student panel and use the disclaimer. Yeah.
Thank you so much,
Anish.
Dr. Swati, and thank you, Mr. Anish. That was a wonderful presentation, and I'm pretty sure everyone would have gained immense knowledge and ideas from it. So it has been a great start to the day, day 2 of World Pharma Brand Managers Day 23. But before we move forward, let me share a disclaimer with you all. Dr. Satish, are you sharing the screen for the disclaimer?
No, please, if you have initiate.
Yeah, let me do that. Just a second. I hope the screen is visible.
Yes, Gauravi.
Yeah. So all the opinions, feedbacks, data, images, videos, interviews, or any other material shown during this event is purely for the learning and academic purpose of the subject pharma brand management. None of the views or opinions expressed by the speakers in live mode or as recordings are to be considered as an endorsement of any brand either. This event is a non-commercial, purely academic event, and the content, recording, or any part of this event cannot be used for any commercial purposes. Thank you. Okay, so just move forward. Okay, moving on forward, before we begin with the student panel and the discussions related to e-pharmacies, I would like to present a survey that was conducted by the Pharma State Academy to understand consumer behavior towards e-pharmacies. I'll share the screen in a moment. I hope it is visible.
Yes.
Yeah. So here we have the World Pharma Brand Managers Day Patient Survey Analysis. We at Pharma State Academy conducted a pre-World Pharma Brand Managers Day survey on the acceptance and usability of e-pharmacy in India. And here is an analysis of the survey and the insights that we derived. The survey was circulated and 165 participants participated in it. It was from Pan India, and the rural and as well as urban demographics were involved. So the age group of participants, here we can observe that maximum participants were in the age group 21 to 30 years, and the average age was found to be 36 years. We put up a question where we asked the consumers about their preference of medicine purchase. And as we can observe that nearly 53.3% people still use offline or nearby pharmacies. The usage of online pharmacies are very less, that is 5.5%. And some of these people, approximately 42% people, use both the online and offline pharmacies. On an average, the customer buying tendency towards the online pharmacy is 32%. Next, we asked the consumer that which platforms they prefer while buying medicines online. The maximum number of people responded with Tata 1mg. That is approx 40% of the responses, and others included PharmEasy, NetMeds, Apollo 24/7, Amazon, Flipkart, and some other platforms as well. This was a multiple choice question, so the consumers had to select one or more options that they generally use. Next, we asked them a question about why do they prefer nearby pharmacies. The most important insight that came out was they prefer nearby pharmacies because it is nearby to them, and it delivers their medicines faster. Approximately 58.2% people responded with that option. 57% people said that because of the trust, the long-term association, quality, returns, and credits, they prefer nearby pharmacies. 37% people said that they can purchase the number of capsules and tablets as per their requirement, which is not really possible in online pharmacies. Approx 34% people said that the discounts and membership attract them to purchase medicines from nearby pharmacies. And approx 16% people said that it's a habit for them. Moving on. Why are the consumers opting for e-pharmacies? The ones who responded that they are opting for e-pharmacies, we asked them this question, and 52% of people said that they get better discounts and offers. 42% people said that there is a convenience of home delivery. 30.9% people said that, and I think this is a very important insight that we have obtained. E-pharmacies can be used to order for anyone and deliver anywhere pan-India. The next point is they get a wider choice, availability, as well as substitutes online, as well as assured quality. Thank you so much for going through the survey results with me. Let me stop the screen share and we'll move forward with the student panel discussion. Okay, so now that the stage is set, please allow me to introduce you to our student panel. First up, we have Smith Bhavsar. He is Bachelor of Pharmacy, 4th year student at NMIMS, SPPS, PTM, Mumbai. Next up, we have Trishank Gupta, MBA Pharmaceutical Management student, 2nd year in Jamia Hamdard. Next, we have Vaishnavi Gari, MBA Pharm Tech dual degree course, 4th year at SPPS, PTM, NMIMS, Mumbai. Pankhuri Kapoor, MBA Pharma Tech dual degree course, 4th year at SPP, SPTM, NMIMS, and Karuna Sathe, MBA, Farm Tech, dual degree course, 4th year at SPP, SPTM, NMIMS. Along with them, last but not the least, we have Shashank Shekhar, 5th year, Doctor of Pharmacy, Pharm D, from Pune College of Pharmacy, Pune. Thank you, all of you, for joining us here today. And they will be talking about e-commerce initiatives in pharma retailing, a step towards the benefits of patients. So without further ado, let me ask my first question for the day to Smith. Smith, can you share with our audience a brief about the emergence of e-pharmacy and its current scenario, including how it influences today's pharmaceutical market?
Definitely. I will do that, Gauri. Thank you so much for the question. And in the meantime, I'll just take 2 seconds to present my PPT in front of you all. Yes, can I have one written in the chat box by everyone if I'm audible, visible, and my presentation is there on your screen now?
Yes, it is there.
Okay, that's great. Wonderful. Okay, thank you so much, Gauri, for the introduction, and a very good morning to all the respected dignitaries out here. A big thanks to the team at Pharma State Academy for trusting me with this opportunity, and I'm really looking forward to make the best out of it and share my valuable insights with you all. So without further ado, before we actually get in the presentation, I would like to introduce the pharmaceutical industry to you all with the help of some numbers. The Indian pharmaceutical industry right now is placed 3rd when it comes to volume and on the 13th position when it comes to value. And the domestic market of the pharmaceutical industry is valued around $42 billion, and it is growing at a good pace. Moving on to understand the reason behind the rise of e-commerce, e-pharmacy, what we call it. The simple reasons why the advent of e-pharmacy took place is, to start with, first, low margins. Now, when I talk about low margins, the various stakeholders at the value chain, they were facing difficulties in getting a good share of the margin. There was always a price pressure between all the companies when it comes to the generic market, especially. We were seeing problems with regulation, documentation, compliances. And with that, the biggest problem which was faced at a distributor level and a retailer level was handling the inventory and having multiple SKUs, which is easy in a central warehouse system, which is mostly followed by the e-pharmacy company. But when it comes about being a retailer or a distributor, managing inventory, handling a large inventory it becomes more difficult. So that is the reason people wanted a tech-based solution to increase the efficiency of the entire value chain, get medicines delivered at the comfort of your houses, get some discounts on it. And eventually, we have also seen a rise in the chronic diseases, which has led people to buy medicines frequently, because of which they want a consistent platform. Without taking a lot of efforts, they can reorder the same medicines from one single platform. Talking about the market drivers which have boosted the growth of e-commerce or e-pharmacy in India, the first one, as you can see in front of your screen, is favorable government policies and regulation. The DCGI approval body has put on a lot of regulatory guidance and is basically promoting and boosting the procedure of giving licenses to the e-pharma companies. It's making it easier for them. We have the Digital India campaign, which is run by Government of India, again boosting digital infrastructure and penetration of e-pharmacies. The second point is rise in internet penetration. So as of now in India, around 45 to 55% of the population is already using internet, and the number has somewhere from 50 million, it has come down, it is increased to 624 million in a span of 5 years. So we have a huge population with internet base. The third one is increase in spending power and disposable income. So on an annual rate, our disposable income of every Indian citizen has increased by 16%, because of which they have the liberty to spend their money on not only the chronic diseases, but also to gain nutritional values. For example, now people, the fourth point, which says that people are aware about good nutritional values. People know what has to be done in order to stay healthy. Let that be in the form of multivitamins, other supplements, calcium supplements, but people are aware and they target to be a healthy individual and spend money on good health rather than spending it later on doctors. So that is a trend which is being seen. And the fifth point is high adoption rate towards digitalized solutions. So since the COVID pandemic, we have seen the UPI system, the fintech, bank systems, everything is getting integrated on one platform, and people are adopting to these technologies at a very high rate. So all in all these market driver and all these points have ensured that we see a great growth of e-pharmacy in India and in other developing nations as well. And on the right-hand side, if you can see, this is the market share of these various companies in India at the moment. MedLife is leading this market share, followed by Pharma, then 1mg, NetMeds, and other companies are constituting the 10.5%. And a lot of funding is also being received around, I think MedLife has already raised $100 million in its last round. So a lot of investors, international support is being favored to these companies to expand their horizons and penetrate the tier 2, tier 3 cities, rural India, and further expansion. Moving on to the next slide. Just give me a second. All right, talking about the unit economics. So I've considered this one example wherein I'm understanding that the revenue earned by the sale of one product is 100. Now, usually for any pharmacy company, the gross margins are set to be around 30%. So I've kept 30 units aside, out of which the 70, which is left. From there, I'm reducing 15 units under warehousing and delivery cost. And I'm sure with time, when we have further more hub and spoke models, we have more central warehouses, we have more infrastructure which is supporting these companies, the 15 units is going to come down to 6 to 7 units, and that will again impact their gross margins, that will increase. Then the 25 units right now, these companies are spending high on acquiring customers. And even though the return on ad spend is low, but they are still promoting, they want people to get accustomed to the technology. So they're offering high discount. They're using various publicity stunts to, get the first good hand of the customer base and increase the market share in the entire Indian domestic market. And the remaining 5 units are being spent over overheads, basically IT expenses, salaries, and other related expenses. That would include your transportation, your rent, your inventory management, tools and optimization. And at the end of this entire deduction and the entire unit economics, what these companies are left with is around 20 to 25 units, which can be termed as their profit, which is actually less to be reinvested and expand. That's the reason these guys are also dependent on fundings. But eventually, with time, with more efficiency, I'm sure the margins and the cost of each and every stage of transaction will reduce, and the end beneficiaries would be customers like us. Moving on to the next slide. Now, this is something which is very exciting, and I am super happy to share this with you all, that the new normal, which is being tested by a lot of pharmacy companies, is around these 3 things. The first one being blockchain. Now, we all know blockchain as a technology is evolving. There are a lot of setbacks which are being spoken about for this technology. But all in all, as we know, blockchain technology, you are storing a set of information in various blocks which are distributed across a lot of computer systems, and each computer system is holding one part of the information. So if this actually gets adopted in the e-pharmacy sector, for which a lot of R&D is happening right now, we will see 3 prominent effects. The first one being about data integrity. Right now, there are a lot of problems with prescription, with fake prescriptions, with people using Schedule X drug, and there is no record of that. We don't even have a concrete system to record the ADRs, that adverse drug reactions, which happen. So all these setbacks can be withdrawn from the market if we come to the blockchain technology. Data will remain secure. We will see that the misuse of drugs, the cases which comes of people using Schedule X drug without prescription, and sometimes it happens because India is a large geography to cover. So this is very common. So misuse of drugs will reduce. We will see that each stage of distribution channel of the entire value chain, the accountability, optimization will also increase. For example, right now, the biggest problem is to track the shelf life of a drug. So we have the barcode technology to do that, but with blockchain, the entire process will become highly transparent. We also have the drone delivery system, and the states like Meghalaya have already adopted this system. So we are moving towards last mile delivery. It's not to your doorstep, it's to your window right now. And we'll eventually see decrease in lead time, super fast deliveries, geographical arbitrage. Like India as a whole has geographical diversity. We have mountains, we have riverbeds, we have oceans, we have everything, which makes it difficult for companies to deliver it to your doorstep. So drones are definitely going to help and boost this. And also we have AI and IoT, the Internet of Things, and artificial intelligence. With the help of this technology, we'll be able to forecast the demands of medicines much before the occurrence of the disease is prevalent. We have seen that in COVID. So AI is the tool, AI is the future. People say that it can be implemented here. Supply chain disruptions, data utilization. So whatever data you have, you can use that in order to enhance your supply chain. And moving on to the industry trends, just give me a second. There's a bit of lag on my screen. All right. So moving on to the industry trends, we have seen that the revenue of these e-commerce companies have increased drastically. So the market share, which was in 2019 around 1.5% of the total industry, has increased to 5%. And they're sharing around $2,100 million of the entire revenue. And the growth of revenue is at a great CAGR. It's almost at 54%. And they've already captured 5% of the revenue share in the entire pharmaceutical industry. And as you can see, the exposure of these e-pharmacy companies, have put them down in number of cities. So that is also increasing. Now, the main preliminary target of these companies is not only to deliver medicines, but also to provide hand-on solutions for other brackets, which might include one-on-one consulting with doctors and buying insurances. So they are basically, what they are doing is they're evolving their revenue chains. They're increasing the sources of revenue, along with that providing good services to customers. And at the end, we have penetration into tier 2 and tier 3 cities. So these guys are highly motivated to enter the rural India and leave a mark there. And with that, I genuinely hope that this presentation has delivered some value. I'll be open to questions at the end of the entire panel discussion. And I hope I've delivered what I was supposed to. And thank you so much for listening to me so patiently. Thank you so much for this opportunity. Over to you, Gauri. Thank you very much.
Thank you so much, Smith, for that wonderful all-round introduction, and additionally talking about the new normal. Okay, so we'll move on to the next panel member. We have Trishank. Trishank, my question for you is, can you tell our audience about the significance of e-commerce in the evolution of pharma retailing?
Yeah, thank you, Gauri, for the question. I will be taking you through that. I hope my screen is visible to all of you.
Yes.
Yeah, okay. A very good morning to one and all present here. So I will be taking you through the role of e-commerce in the evolution of pharma retailing. Although e-commerce is itself a revolution for many industries, and a lot need to be done in our pharma sector. So e-commerce in general terms is the purchasing, selling and exchange of goods or services over computer networks. So we can say that e-commerce offers a virtual marketplace for the sellers and the consumers. The second thing that it offers is timely access to information. In our case, it is medical information. The service providers educate their users about the latest updates, innovations, features, developments, etc. with the help of their platform on web. All this information is easily accessible at the comfort of the user. The third is shrinking geographical locations, making the distance factor negligible or irrelevant with optimized logistics. We recently witnessed the testing of home delivery via drones in remote locations or the harsh areas. The fourth is collection, storage, and access to data. So with the use of e-commerce portals, the service providers obtain a lot of data from the users, be it demographic, geographic, medical, etc., which can be used for providing personalized services to the consumer, bringing in the concept of patient centricity. I will come to this in a while. So, this is simply what e-commerce offers in a broader perspective. Now, coming to the timeline, this concept is not new to the world. It's been 28 years since the emergence of companies like Amazon and eBay in 1995. And in pharmacy, it was 1999 when Soma.com became the first pharmacy to operate online. But in India, this evolution came in year 2015 with the companies like Pharmacy, 1mg, NetMed. All of these were founded in the same year. So you can see how late India adopted this concept. There are different reasons for that, though. Now, even when it started in India, users were reluctant towards the new approach, which created a lot of challenges. Now, let's see how e-commerce made space for itself in the pharma industry. See, pharma is an industry of innovation, which involves a lot of research and development work. And technology involved are of two types. One is hard tech, and the other is soft. With hard tech, I mean machines and equipment, and with soft, I mean the internet and software. So the hard technology is involved in the innovation process. But when the soft technology is used to make most out of the innovation and generates revenue, collectively, this is electronic commerce for pharma. Now, if we look at the number of users of e-pharmacy worldwide, they were 1139 million in 2019, which grew to 1506 million in 2022. So you can clearly see the difference. And with this, it is evident that COVID also played an important role in the rise of e-commerce. When people were not allowed to go out or they were suffering, they found it easier to use e-pharmacy and get their medicines delivered to home. This not only helped public, but also the government in the management of healthcare services during the tough times. In the short history of e-commerce in pharma, it played significant role in the evolution of pharma retailing. Let's see how. It provided e-marketplace for the retailers to carry out not only B2C transactions, but also B2B and B2B2C. We all know there is direct involvement of the end user in the e-pharmacy, but there are also few platforms where pharmaceutical companies and stockists can sell medicines in bulk. Then there are agencies of the existing e-pharmacy stores which are physically present, or the physical stores that can take orders online from their platforms. This is B2B2C model. Currently, Pharmacy is doing this. Apart from this, SME players in the pharmaceutical industry are largely unorganized in nature. This concept of e-com helps them to reach out to the market and get business opportunities from different states of India. Even abroad, they can get opportunities. E-commerce brings standardization of processes, documents, and regulatory issues for online payment of prescriptions. With every action monitored and recorded, it makes the process standardized from the delivery chain to the end users. Next is, e-commerce provides a single and specific space for pharma SMEs to rest of the world, keeping the industry organized and reducing costs by avoiding others to interfere. The data-driven approach for patient centricity. This is the point. So the generation of EMRs and the tech-based collection and storage of data, which can be used lifelong. Yesterday, 𝗿𝙧𝙪 discussed about patient adherence and the role of AI and data in it. These things bring patient adherence, not only patient adherence, they help to understand the buying behavior and persona of the patient so that companies can provide customized and personalized services to the patient. Next is influence and support of government. The Department of Pharmaceuticals formulated the DPP, the Draft Pharmaceutical Policy in 2017, wherein it has recommended that e-pharmacy should be encouraged in the interest of the consumers. So it is very important to have the support of authorities to scale the advancement for the benefit of the public. Sixth point is integrated digital pharmaceutical distribution platform. We all know about the e-pharmacy retail stores where consumers can directly purchase medicines. They're quite popular though. But there are also online platforms for retailers and distributors which facilitate the supply chain. Let's see what it is. You might have heard about ShipRocket. It is a logistic support platform. And then there are companies like Amazon and Flipkart who have their own logistics, Amazon Shipping and eCart, right? Similarly, in pharma industry, there are companies that have set up an integrated platform for both the distributors and the retailers, creating a bridge between the pharma companies, stockists, to the retailers. For example, Savio, PharmaRack, and Vizarma. They are the e-commerce platforms, or we can say marketplace, where companies, stockists, retailers, all are present, and they need not to worry about the inventory management, logistics, and billing. With Vizarma, even hospitals can place and track orders. It is so personalized that companies and hospitals can have real-time access to the data of the products available at the CFA. With PharmaRack and Savio, retailers can connect with their existing distributors, or they can find new distributors. They can order stock and manage inventory easily. Retailers have given testimony that they receive the delivery of the stock within 3 hours. And even if they place the order at night, they receive the order next morning. So not only retailing is getting benefited, but also the other counterparts of the supply chain. So this is the impact of e-commerce on pharma industry as a whole, and it will be interesting to see how it goes in the future. So I hope you got my point of view on this. Thank you.
Thank you so much, Prashant. That was a wonderful presentation. And moving on, my next question is for Vaishnavi. Vaishnavi, can you please tell us what merits of e-pharmacies are we able to observe these days over the conventional pharmacies and their importance in the customer journey?
Absolutely, I'll do that. Thank you so much for your question, 𝘿𝑗. I'll just begin shortly.
Yeah, just a moment. I'll share the presentation on your behalf.
Yes, thank you.
Yeah, I hope the screen is visible.
Yes. All right. So a very good afternoon to everyone present here today. As I speak about the merits of e-pharmacies, I'd like to talk about how the online pharmacies add value to the customers. Let's go by all the steps involved. Next slide. Number one, as I've mentioned here, is the accessibility and the availability. So e-pharmacies can offer a wide range of SKUs to their customers by aggregating supply. Such scale is actually difficult to achieve for local pharmacies because it's not possible to aggregate supply for them. And e-pharmacies have been able to reach tier 2 and tier 3 cities as well. The key factors that were responsible for the increase is because of the increase in internet penetration, a surge in the number of smartphone users, innovations in the digital payment infrastructure, and the increased adoption of online shopping among tier 2 and tier 3 city individuals. And during COVID, we saw how these pharmacies had all the medications available while the local pharmacies ran out of stock. And so at such a crucial time, it proved to be beneficial to the customers because of a health emergency. Number two is the convenience aspect of it. E-pharmacies have their own websites and mobile applications, as all of you all are aware of. You can place the order within minutes and you can get your prescription drugs conveniently. All you need to do is upload the valid prescription using the mobile app or website. And there's no need to actually go and visit the pharmacy store and wait in long queues. The medications get delivered on time at your doorstep, and the customers who actually regularly require medications would understand the value and the ability of medicines to be delivered to the doorstep. Additionally, if you choose an online pharmacy to refill your regular prescription, your whole prescription log is automatically maintained in the database, and there's no need to re-enter the information, which again serves as the convenience aspect of it. All you need to know is a basic knowledge of a computer or a smartphone, and you can easily shop from an online pharmacy and save your energy and time. Number three is the affordability. E-pharmacies can source the products directly from the manufacturers, and therefore they have the capability to offer more significant discounts than local pharmacies. And therefore, to attract buyers, the online pharmacies offer special discounts on medications. So anyone can avail the discounted coupons on regular purchases of medications. Moreover, it is also clear as we buy medicines more and more from e-pharmacies that when you become a regular customer, you can buy medicines at low rates in the future, and you can also utilize their membership schemes for this. Number 4, as I've mentioned here, is the information and education. So e-pharmacies provide knowledge to the customers, and that helps them to make informed decisions for themselves. Most online pharmacies, they share useful and valid, accurate information about medicines and illnesses on their mobile apps and websites. Detailed information about the use of a particular medicine, its side effects, its drug interactions, its consumption patterns, what recommendations are given, whether it is to be taken before meals, after meals, on an empty stomach, and so on, are clearly mentioned there. You also have access to expert guidance. One of the best advantages, what I feel, of an online medical store is that you get a chance to talk with a professional pharmacist to clear any of your doubts and queries without leaving your home. Number 5 is the compliance and authenticity aspect of it. So the authenticity of drugs can be assured because e-pharmacies store all their records digitally, which effectively reduces the risk of having any counterfeit medicines. It serves as a secure system overall. So when you purchase your medicines online, you don't have to worry about any credit card information that you have stored in it. All the reputed companies, like we have Tata 1mg, Apollo, NetMeds, they all follow regulations and they ensure that you're secure and that your payments are stored in a secure and safe manner and there's no data leakage. Another point I would like to mention is that the best thing to consider about online pharmacy is the customer care aspect of it. The customers can avail 24/7 services from the online pharmacies. If you have any query, any doubt, their customer care representatives are always there to help you any time of the day, any day of the week, via a call or an email. And another thing which all of us might have noticed is that e-pharmacies provide a value-added service, which is e-consultation, e-diagnostic services, and health insurance services, which are not there for local pharmacies. Moving on to the next slide. So from the previous points, we can understand that the merits of e-pharmacies, they promote a positive customer journey. As you can see on the right, I have added screenshots from 1mg's mobile app. So here we take example of this drug called calcium polystyrene sulfonate powder, which is used for the reduction in high blood potassium levels in patients with hyperkalemia, which is associated with chronic kidney disease. So this product comes in a 15-gram sachet that is to be consumed 1 sachet at a time. And the price is rather high. It's about 160 rupees per sachet, and the recommended dose to hyperkalemia patients is usually 3 sachets per day. So this makes the process very expensive to the patient. But if you consider an e-pharmacy there, the discounted price offered is lower. That is, it's 135 rupees per sachet. Additionally, they have provided certain cashback offers, redeemable points on the next order, and credit card offers, which make it affordable to the patient. Not just this, as you can see on the extreme right, the app shows some alternate SKUs having the same composition with their prices. So the consumer can take informed decision and opt for these SKUs without any extensive research on the internet. These e-pharmacies clearly state that all such information and recommendations is purely for information purpose, and the patient must consult his doctor before taking any of such medications. Thus, this way the patient is provided with useful information, and it is up to his discretion if he wants to switch to any less costly product or not. The table on the left gives us an overview of what we already discussed. So the price factor serves as one of the most substantial merit of e-pharmacies because of its extensive offers. Whereas local pharmacies, they either sell it at MRP, or if they have a long bond or a trust with you, if you're a regular customer, then they might offer you 5 to 10% discount in some cases. Then the safety and the security aspect of e-pharmacies is slightly higher than local pharmacies because every prescription that is uploaded on the website or app is reviewed by a licensed pharmacist before the order is accepted. And before the order is accepted by the company, the pharmacist from there would call the patient or the caregiver to reconfirm and ensure that the right medication has been ordered and there's no scope of error even in the prescription. The ordering process is also much convenient this way. All in all, I'd like to conclude by saying that e-pharmacies have developed as a potential sector due to the significant shift in purchasing behavior, and it's definitely going to be the future of pharma retailing. Thank you.
Thank you so much, Vaishnavi. for the wonderful presentation. And moving on, my next question would be for Karuna. Oh, sorry. My next question would be for Pankhuri. As we all know that there are always two sides to a coin. As much as it is advantageous to use e-pharmacies, there are also some demerits to it. So, Pankhuri, I would like to direct this question to you. Can you share with us what you think are the disadvantages of e-pharmacies?
Sure, Gaurav, thank you so much for your question. So a very good afternoon, everyone, and I'm indeed very grateful to be a part of this student panel. So Gaurav, if you can present the slide on behalf of me.
Give me a moment.
Yeah, so thank you so much. So moving on straight to the answer to the question, if you can move to the next slide. So the very first limitation is software design issues. Now, the designing features of e-prescribing software may increase the likelihood of the errors. Drop-down menus, poor screen design, and automatic filling functions have been identified as potential sources of errors and consequently as threats to the patient's safety. Additionally, these design features may contribute to workflow challenges as they dictate manual entry and editing of prescriptions and potentially follow up with the providers to resolve gaps, errors, or lack of clarity. Now, the next one is lack of physical evaluation in place. Now, since the internet makes it so easy to sidestep the safety net, these online stores do not have any processes of medical supervision or physical evaluation in place. If at all there is any such process, they are not performed by a licensed health professional. Next, being need of using the same online pharmacy all the time. So if you do not use the same online pharmacy all the time, they may not be aware of any potential drug interactions. It can be difficult to find someone to answer any specific questions about medications you may have. It is not possible to get the prescription the same day, and you lose the personal interaction available in a person-to-person transaction. Now, the next one being a very important point, that is selling of scheduled drugs. Now, online selling of drugs possesses a serious risk of selling Schedule X and Schedule H medicines to the customers. Drugs which fall within these two schedules shall not be delivered to the customers without prescription and is a crime. Proper customer record needs to be maintained, including name of the patient, doctor, and address. A single prescription can be used for multiple delivery of drugs through different e-pharmacy websites. A proper regulatory framework is the need of the hour to deal with this complicated issue, as this may rise the percentage of drug abuse in India. Another important issue which needs proper regulation is the selling of drugs to minors. It will be very difficult to trace the authenticity of the prescription when it is uploaded in the websites for online purchase of the drugs. The next one being, there are some online pharmacies that do not adequately safeguard your health. By failing to require a prescription, you could take medication that is not appropriate for you. It could make you sick or even kill you. Some illegal online drug stores deal in dangerous, contaminated, and counterfeit or outdated drugs that can lead to dangerous drug interactions. The next one, another major point, that is some e-pharmacy websites do not adequately protect your personal and financial information. Data security and patient confidentiality are important concerns. Many sites do not secure customers' information post-purchase. Emails often contain unencrypted links to customer information, and online transactions are inadequately protected. Such site vulnerabilities can lead to consumer fraud and inadequate data protection. It's important for pharmacy websites to publish their privacy policy, one that promises not to share your personal information with third parties. Online financial transactions should be secured through adequate use of encryption technology. The next one being cost disadvantages. So other limitations of e-pharmacy includes cost associated with use, startup, maintenance, and transaction fees. Although large chain pharmacies are able to negotiate lower transaction fees, smaller chain and independent pharmacies pay more to utilize e-prescribing software. Additionally, not all community and mail order pharmacies have the ability to receive new prescriptions electronically. And the last one, but not least, barriers to adoption of e-commerce in India. So according to the use of Internet and Mobile Association of India, urban India is fastly adopting e-commerce, online payments, and transactions through the net. Although the popularity of these services is growing rapidly, they are still very limited in spread and scope, especially in the rural India. In addition to that, the concept of e-pharmacy is still at a nascent stage. Consumers are expected to face different problems while placing orders online. These problems may be related to technology, operation processes, or government norms. Moving on to the next slide. So these are some of the past cases mentioned here. So now the Drugs Controller General of India, that is the DCGI, had directed all the states and union territories to prohibit the sale of medicines through unlicensed and online platforms as per the Delhi High Court order. CADE, that is the Confederation of All Indian Traders, said that it had strongly raised the issue of malpractices that are being conducted in the online pharmacy trade and alleged that the firms are conducting business practices in contravention of provisions of the Drugs and Cosmetic Act. Rules concerning the interstate sale of drugs are not well established, and so there is a high possibility that drugs valid in one particular state may not be considered in another state, and a similar incident has already been registered in the Mumbai Food and Drug Administration. So that's all from my side. I hope I have answered your question. Thank you so much.
Thank you so much, Pankuri. That was a very insightful presentation. And we'll move forward. My next question would be for Karuna. Karuna, I would like you to shed some light upon the scope of e-commerce in the pharma and healthcare industry for the upcoming 5 to 10 years.
Thank you so much, Gauri. Am I audible to everybody?
Yes.
All right, just give me 2 minutes to share my screen. I hope this is visible to everyone.
Yes.
All right. So without further ado, let's get into it. Now, on my starting slide, I've included 2 pictures. Now, the first one represents the online pharmacy sector, a chemist, which is exposed to the e-commerce sector. And the second one is a cartoon or a comic strip rather, which talks about how didn't I warn you about buying medication from the internet? And this is prevalent because while we have discussed the merits and the scope of e-pharmacy, there is also the demerits of e-pharmacy. And combating all of that, let's take a look at what the e-pharmacy sector will look like in the next 5 to 10 years. So, the pandemic. What really happened in the pandemic? India has witnessed a large-scale e-commerce disruption over the past decade, with people buying everything online, from groceries to apparel. The trend has been more pronounced over the past year, with the pandemic necessitated lockdown and distancing, pushing people online for their day-to-day needs. E-pharmacy is one such tool that came into the fore of our fight against the pandemic. Indian e-pharmacies, which emerged around 2015, have disrupted the market and gained traction rapidly. Currently, there are close to 50 e-pharmacies in India, and estimates peg the market size in 2019 at 0.5 billion, approximately 2 to 3% of the total Indian pharmacy sales. Now, currently, if you look at the pie chart that is provided on the screen, you might think, oh my God, online pharmacies, I can't even see that. There's barely a strip available. But along with increasing customer adoption, there has been a secular rise in an investor interest in e-pharmacies. Pharmacy acquired diagnosis firm 𝘖𝙗𝙗. This was the second big acquisition after MedLife by Pharmacy within a month. Online giant Amazon began doorstep delivery of drugs. Conglomerates like Tata and Reliance acquired 1mg and NetMeds respectively. And all these transactions took place despite the COVID-19 pandemic, despite online pharmacies not having such a big presence in India, despite Indians having a very specific consumer preference where all of us like to go to the pharmacy store, physically check the goods and then buy it. So then why? How has this shift been happening? As India went under lockdown, realizing the importance of e-pharmacies, the union and state governments took no time to classify them as an essential service. The government also took to promoting e-pharmacies and their associated services through the 𝘍𝐴𝐸 Mitra portal on 𝘍𝐴𝐸 app. These measures turned out to be greatly beneficial to all consumers and e-pharmacies alike. Collectively, the sector was able to achieve 2.5 into growth in households using their services, with the tally hitting 8.8 million households in June 20 itself. That was like the pandemic started in March and June 20 was literally 3 months later. People are apprehensive about exposure while venturing outside for medicines and lab results and prefer online options, and the need at present is unbounded. Therefore, additionally, more than 45% of the new users onboarded were based out of non-metros. This is a very significant statistic because even after the online restrictions were eased and offline stores were made accessible, the platforms continued to get a total of 30 to 40% increase in sales as compared to pre-lockdown figures. In the second wave, e-pharmacies reported a 22 to 65% increase in sales, and a demand for COVID medication like tocilizumab or favipiravir surged by a 5 into stand. A key takeaway from all of this is that e-pharmacies have demonstrably critical role to play as we continue to fight the virus. Traditional pharma retailing in India is a highly unorganized and fragmented, with close to 8.5 lakh unorganized retailers contributing to more than 90% of the sales. It is also really significant to note that the All India Chemist Association actually went to the Supreme Court and issued a rally against the online pharmacy sector because they have lower margins and they can afford to sell these medicines at a higher discount rate. Obviously, the case is still going on, but this just proves that e-pharmacies have been taking over, and it's actually a bit of a concern. Now, the growth drivers that I have put on the screen, the unorganized nature, it counteracts with the e-pharmacy, which are extremely organized. There's a supply chain, there's a distributor network, which is already thought of. There's governmental support, as I mentioned. The value and convenience offered is tremendous, as it has been discussed by all my previous panelists, and the tremendous untapped potential of tier 2 and tier 3 cities, which prove that, yeah, due to increased internet penetration, what has happened is everybody can access all of these sites. It's no longer that rural areas are completely cut off from the internet and the services that they provide. Therefore, e-pharmacies are the way to look forward. Moreover, e-pharmacies ensure safer drugs. A report by the WHO found that about 10.5% of the medicines sold in low and middle income countries, including India, are substandard and falsified. E-pharmacies ensure a genuine drug supply, sourcing it directly from manufacturers and licensed resellers. They improve access. Medical needs of rural India are undeserved due to limited access to pharmacies. With an ever-expanding logistic network propelled by e-commerce over the past decade, e-pharmacies have an edge over this. At the moment, e-pharmacies are catering to 20,000 plus PIN codes. Also, how many times has it happened that you have gone to a pharmacy and a certain drug isn't available? This is not the case with e-pharmacies. An average offline pharmacy is limited to 6,000 or 8,000 SKUs. But in contrast, the online pharmacy can cater to 50,000 SKUs at the same time, giving them a significant advantage. Powered by digital backend, analytics, AI, e-pharmacies can better manage their supply chain, ensuring a high fill rate of about 95% and avoiding stockouts common in traditional offline pharmacies. When we look at the challenges, obviously there are cyber threats and data security issues. There is impending legal framework, but the securing healthcare data of the patients is going to be a key priority. Recognizing this issue, the government is already working on a Personal Data Protection (PDP) Act and Digital Information Security in Healthcare Act. Different countries have enacted specific laws, and DISHA, as the act is coined, it aims to be the Indian counterpart of similar laws. The need for constant technological upgradation is greater being pushed. And as my fellow panelist Smith talked about drones and other AI methods, these are being taken care of by e-pharmacy platforms. Now, the lack of trust and the consumer preferences, that is also being taken care of, because that is no longer the case due to a prevalence of lifestyle diseases and the changing consumer preferences, specifically after the lockdown, where people were forced shut inside their house. So they had no other option but to order online. it is changing slowly and gradually. This change is coming about. And as we look at the scope for internet penetration, increasing investments, increasing medicine spending via our healthcare budget itself, these are all the factors that are being taken care of as we slowly evolve. Finally, I would like to introduce all of you to the Apollo loop. This is a case study and that I would like to take a look at. Now, everybody must have heard the name Apollo in some form or the other. There's Apollo hospitals, there's Apollo pharmacies, there's Apollo wellness, there's Apollo information center. You can get diagnostic services, specialized services, value-added services. What can you not get at an Apollo clinic project? Now, this is what I want to take a look at, because what has happened is Apollo Wellness was actually found in 2001. That is fairly earlier. Earlier, it was only in hospitals, and then there were pharmacies that were available. 24/7 pharmacies started evolving around 2005. And then you see Apollo gradually going into different sectors. Now, not only do they provide you with online pharmacy stake, which is going to grow in the next 5 years as projected by different articles and consulting firms, they also provide you allied services like you get a doctor at home, you get a nurse at home, you get medical devices at home, you get diagnostic tests done at home, you get a physio at home. Also, there is Apollo Cradle, fertility, spectra, dialysis, pharmacy, clinic, dental clinic, sugar, diagnostics. What do you not get? Once a patient is there, he's completely taken care of. More than that, they have also poured it into the medical tourism sector and the telecommunication sector, because you can see they also take care of the visa, ticket transfers, your local accommodations. Not only that, they take care of your sightseeing as well. They maintain communication throughout, and you get the best of the treatment at Apollo hospitals, because Apollo has developed and positioned itself in such a way that it is not only attractive to the consumers, but is also attractive to the physicians and the nurses who would want to work there, automatically increasing the brand value and the care that is offered. The speed of treatment is unsurmounted, and the customer doesn't lose any valuable time that may take, sometimes you go to the hospital and you lose a lot of time filling a lot of paperwork, finding out the correct insurance services and whatnot. This is not the case with Apollo. You're completely taken care of. It is a one-stop loop. You enter and you are completely taken care of. And this is where we are heading towards. I think the e-pharmacy sector is also going to get into this. 1mg and other platforms have already started offering diagnostic tests at home too. They have already started partnering with other diagnostic firms near your areas. And I think this is where the sector should be looking forward to in the next 5 to 10 years. Thank you.
Thank you so much, Karuna. That was wonderful. And that was a very wonderful holistic overview of the future of the e-pharmacy. Beautifully explained. Now, moving on, my next question would be for Shashank. I would like you to share your views on, does e-pharmacy work on the principle of patient centricity, and what limitations do you think that they have?
Thank you, Gauravi, for putting the question. Can you please confirm, is my screen visible or not?
Yes, it is.
Okay. Just a second. So now, first of all, we'll see what is actually patient centricity. When we talk about patient centricity, as Mr. Mitra explained before, like catering all the needs of the patient in all the perspective, like you see, whether it be the life insurance of the patient or connecting the patient to various specialty aspects, or checking the utilization review. We often miss out the utilization review. What is actually the utilization review? Checking all the drugs that patient has been consuming in his lifetime, checking the history of the patient, checking the demographics of the patient, and then prescribing a particular drug to the patient. Now, moving on ahead, what are the challenges of an e-pharmacy being patient-centric? There are certain consultation limitations. Like suppose if we consult a physician or a registered medical practitioner online, there are various limitations to it. The chance or the need of physical examination gets often missed out. That is very necessary when you visit a physician. You would also have seen that you are visiting a physician with a certain problem, and the physician analyzes a very different problem. Why? That is just because of the physical examination that gets missed out when we are having an online consultation. Now, next is missing communication between the patient and the pharmacist. This is a very important aspect which is also getting skipped out if we talk about purchasing medicines directly from the e-pharmacies. I'll give you a very common example about using the inhalers. There are various types of inhalers. The common one we know, that is the L-meter dose inhalers, that you just need to press the pump, take in the contents. People don't even know how to use it. Some patients are using it incorrectly and their asthma or COPD is not getting help because of it. Another common example I'll give you about ENO. Many people do not know how to use ENO. Generally, what they do, they take a glass of water, they put the sachet in it, and they just sip it like cold drinks. That is not how ENO should be taken. Once you take a glass of water, you put the sachet of ENO, and you just need to directly ingest it, because that is working on the principle of effervescence, and that needs to be carried out in your stomach. So this all things has to be explained by the pharmacist to the patient, where I feel a communication gap develops if we talk about e-pharmacy. Now, next is the lack of infrastructure in the rural areas. Though the internet is penetrating into the villages, but people are very reluctant to shift to these forms of consultation and seeking medications online. Now, next is the concern for data piracy. Even the companies are claiming that their the patient data is getting private, everything is private, but still educating the common folk about it is a big concern. They still feel that their data is not safe. They still feel that whatever the video interviews they're giving to the physicians might get leaked, or it might hamper their self-esteem somehow. Now, next is inability to prevent self-medication. Now, self-medication is an important factor which is very common and rampant in India. Self-medication needs to be stopped at any cost, and I feel that sometimes e-pharmacy cannot stop self-medication. Like suppose if a patient is on some kind of antipsychotics or antidepressant medications, the person can present the same prescription at different various sites, different e-pharmacy sites, and can obtain medications and can abuse those medications. So this is how we have to prevent self-medication. Common example is like antibiotics, rampant use of antibiotics for every condition. So these often lead to further antibiotic resistance. So this is how self-medication is a very malpractice continued, and that has to be stopped. Now, next is the telemedication consultation should be limited to first aid, life-saving measures, counseling, and advice on referral. Not for every disease we can rely on e-pharmacies, but yes, they can be very helpful if we are in certain kind of emergencies. If a patient or any family member is experiencing any kind of emergency and needs to be managed immediately, in such conditions, we can refer these e-pharmacies for getting specialized support. Not for all the cases. Where there are chronic cases, we should adopt the physical as well as the digital model. Though in the pandemic, our hands were tied, we had to stick to the digital model, but post-pandemic, it will be very beneficial and it will be more patient-centric if we shift from the digital model to the physical as well as the digital model. Next, we'll move on to the limitations, what we feel in consulting online. We can consult the physician via video, audio, or text methods. If we consult via video, that solely depends on the quality of the bandwidth, which will not be there if we talk about the rural areas. So patient will not be able to explain his condition well to the physician in front of him. Now, the patient feels that their history gets leaked. This is a very common concern of the patient, that whatever the video consultation or whatever the signs and symptoms of his disease the patient is showing to the physician, that video might get leaked, and the physical examination of course gets skipped. That is a very important factor. Like the physician cannot osculate the patient. The physician will not be able to check the heartbeat of the patient and to arrive at further conclusions. The physician will not be able to check the pallor of the skin, the color of the skin, which is also very important in prescribing medications. So all these are the factors that get skipped if we consult online. I'll give you a very relevant case that I had came across. Like there was a geriatric patient. The lady was 63 years old and she presented to the physician with complaints of just weakness. And if she would have consulted online, or she would have just done self-medication, she would have just taken the multivitamins and continued her therapy. But when she came to the physician on osculating, on checking her heart rate, it was just 24 beats per minute. That is drastically low. And she was immediately shifted to the cardiac care unit where pacemaker was installed. So these are the limitations, and overseeing these situations can lead to a very fatal situation. Now, next mode of consultation is audio consultations. Though the patient is explaining all what he is experiencing on a call, but is the physician really able to interpret? There are certain non-verbal clues which are often identified by the physician in the physical presence, which get missed out. Now, the patient identification remains unclear, and there are chances of imposters representing the real patients. Like I just gave the example about using antipsychotics. There are these drugs which you use or you abuse, they can even lead to respiratory depression. So in such forms of consulting, some other person may mimic the original patient and may seek the drugs if it is via audio. And text mode of consultation, it is very difficult to establish rapport with the patient. The patient will be typing everything, he'll be getting the text support, but this is again very much non-reliable form of consulting with the physician. So I feel these all are the limitations about e-pharmacies being patient-centric. And again, I'll emphasize that we need to move ahead with the physical as well as the digital model. So I hope I was able to clear my point with you. Thank you, Gaurav.
Thank you so much, Shashank. Very, very valid points were mentioned by you. It was a very beautiful presentation.
Yeah,
Okay.
and Gaurav and the student panel, wonderfully done, presenting merits, demerits, scope, the way it is going forward. Awesome work by you all. Dear participants and audience member, you may be seeing 7 to 8 minutes of presentation here, but believe me, a lot of work has gone in creating these presentations, and the students have done wonderful job to give you a overall 360-degree picture of the talk of the town, that is e-pharmacies. We are receiving certain questions. We are receiving certain concerns from the pharmaceutical professionals about promoting e-pharmacies. We do not promote e-pharmacies. We, through this talk, just want to point out the way the dynamics is shaping up in this space. So please be here with us. If there are questions around those, we will answer it after the faculty panel discussion is over. Students, well done. We are very proud of you. Keep growing and stay with us. Vivek sir, your comments, and Saurav, your.
It was really a good presentation from all of you. Hats off, and hats off to the mentor also, Saurav. I just have one question for Pankuri. Somewhere you mentioned about the e-pharmacists giving support or telling the patients about the drug interactions. Could you please elaborate on this a bit? Whether e-pharmacists really give this kind of guidance to the patient on the drug reactions? And when you're talking about the drug reactions, are you referring to the adverse reactions or the side effects?
Yes, sir, I'm referring to the adverse drug reactions that take place. So when you are switching to a new, like everyone is using that particular e-pharmacy website from where they'll order continuously. And if you're switching to a new website completely, so the trust and the conversation that was made between the website and the personal interaction that was being held at that website is completely new to the new website. So if you are ordering another medication, and if suppose that medication gives some adverse drug reactions or some drug interactions, so that the new e-pharmacy website might not know your history, and if they might not know your history, so it will result when you'll order those drugs, they won't provide any kind of feedback or any kind of text or any kind of information regarding the drug interactions or drug-drug interactions that can take place. So that's what I meant while switching to a new website.
Sort your comments, and then we move towards the faculty panel. We have our esteemed faculty panel waiting to talk about pharmaceutical value chain. Saurav?
Sorry, I was not allowed to unmute. So extremely well done. One thing to say that when students come up with such type of, presentation, so it is something like the industry is going to get good resources in future, in fact. So the knowledge, the clarity, and the quantum of work this all team has done, it's really absolutely well done. And during the New Year time, I also forced him to go ahead with the presentation, read some articles, and then come back. Absolutely great job done by the team. I am very, very satisfied with it. Thank you, Swati. Thank you, team. Thank you, Vivek sir.
Thank you. And Satish, I'll ask to please add Vaishnavi to the panel and take a screenshot. We are very proud of our student team here. Did a wonderful job despite their classes going on, exams in fray. So yeah, Satish, if we can add Vaishnavi to the fray and
Yeah, actually, yeah.
Yeah, you can remove me.
No, removal is not required. I don't know why. Not able to add.
Okay, we'll take it later. Thank you, dear student panel. And stay with us. There are questions, there are difficult questions. So stay with us, answer those, and enjoy the discussions. Moving ahead, Gauravi, over to you to introduce the faculty panel and take up the questions.
Thank you, Dr. Swati. So without waiting any further, let us begin with our next panel. And the faculty panel with the esteemed faculties associated with the leading pharmacy and management colleges in India. And they will be talking about patient-centric approach in the pharmaceutical value chain from drug discovery to marketing or drug commercialization. Although I know the names need no introductions, but for the sake of protocol, let me introduce our esteemed panel here. We have with us here Dr. Atul Nasa. Dr. Atul Nasa has worked as the head of the Office, Controlling and Licensing Authority and Deputy Drugs Controller with the Drugs Control Department, Government of NCT of New Delhi. He has more than 37 years of professional experience, including 30 years of experience in the enforcement of various pharmacy-related acts and rules. Apart from all this, he is also a member of the Drugs Consultative Committee, DCC, and other committees of the Government of India constituted from time to time. Thank you so much, sir, for joining us today.
Thank you very much.
Next, we have Dr. Sandeep Narula, Director, Pharmaceutical Technology Management, SPP, SPTM, NMIMS University, Mumbai, spearheading B Pharma plus MBA and M Pharma plus MBA integrated programs of FPP, School of Pharmacy and Technology Management, NMIMS University, Mumbai, responsible for the entire business vertical, including growth, business development, ranking, and excellence in all the designated areas. Thank you so much, sir, for joining us here today. Next, we have Dr. Sunil Kanwinde. Dr. Sunil, after completing the PhD from University of Bombay, joined pharmaceutical industry and has been associated with industry since 1986. He has experience in development, technology transfer, and in manufacturing and packaging development of various dosage forms. Along with that, he also has managerial experience in plant management in German Remedies Limited, Merck, and now Ranbaxy for 2 major plants in India, and is also experienced in regulatory audits from FDA, EU, ANVISA, PMDA, Japan, and KFDA. Thank you so much, sir, for gracing us with your presence. Then next, we have Dr. Tanjul Saxena. Dr. Tanzil Saxena is presently working as a professor and principal at Mahatma Gandhi College of Hospital Administration, a constituent college of Mahatma Gandhi University of Medical Sciences and Technology. She has a total of 29 years of experience that encapsulates over a decade of corporate exposure, in addition to teaching, training, and consultancy in the realm of management. Dr. Tanzil Saxena possesses a world view of interdisciplinary education. She has 3 anthologies, 2 books, and about 40 papers and cases to her credit in the realm of education and management. Thank you so much, Dr. Tanzil Saxena, for joining us here today. Next up,
just give me a few seconds. I think there are some connectivity issues from the panelists.
Yeah, introduce Ms. Sanju Gauravi till then. Yeah.
Yes. Also, we have Ms. Sanju Yadav with us. Ms. Sanju Yadav is a seasoned pharma professional with 18 years of progressive experience in sales and marketing. She has managed brands and businesses in a wide range of therapy across leading MNCs and Indian companies like MSD, Alembic, Pfizer, Merck, Cipla, and so on. She has expert-level mastery in marketing and is a lifelong learner and passionate about human potential. She is currently freelancing as a business consultant and serving as a visiting faculty at NMIMS. Thank you so much, Sanju ma'am, for joining us here today.
Thank you so much. It's my pleasure.
I'm so humbled to be introducing all of these dignitaries, and I express my sincere gratitude to all of you for joining us here for this event. So, moving ahead, Dr. Swati, would you like to say something?
Yeah, requesting Dr. Sunil to, sir, please check the video rotation thing at your video button.
Yeah, I'm trying for that, not able to do it, but I will do that, sure.
Thank you, sir. Gauravi, we can move ahead with the questions. Yeah.
Because I'm not able to do that, any suggestion for me.
Introduce the topic and let's start the discussion.
Okay, Swati, can I help, sir?
Yeah, take a minute.
Sir, can you just go into choose virtual background option?
Yeah.
There you will see where your video will be showing on the right corner. Can you see there is a black color sign, a square box?
Done, Sunil, sir. Thank you.
Yes, now it is coming. Great.
Thank you, sir. Thank you for your help.
Wonderful. So shall we move on with the questions?
Yes, Gauravi.
Okay.
Topic of the discussion, introduce the topic and we can move ahead with the questions.
Sure, Dr. Swati. So the topic for discussion today that we have is patient-centric approach in pharmaceutical value chain from the drug discovery to marketing and drug commercialization. And my first question would be for Dr. Tanzil Saxena. To set the context, ma'am, can you please highlight what juncture of patient centricity is in the pharma industry today, with other industries, and please highlight the reason for the same.
Very good afternoon. I hope I am audible, because the moment we started the session, my internet was misbehaving and it took me a little time to join. Am I audible? If you can give me a thumbs up. Okay, thank you. So, very interesting question to start with. When we were preparing for this session, I happened to research, and it was very surprising for me to actually come to realization of this fact that not before 2017, the patient centricity was actually defined properly by a group of people which constituted caregivers, patients, pharma company. So if you look at this, 2017, we are just talking about half a decade ago. Now, very surprisingly, patient centricity has been in the area of health management or health world for pretty long. We have had, patient satisfaction as a topic of research by several scholars. But when it comes to the pharma domain, it is only about half a decade or maximum a couple of years farther down the lane, not in a very structured manner, that we started talking about patient centricity. Now, if we dig deeper, it's very interesting to understand that there are three stakeholders primarily for when we talk about patient centricity. One are the, of course, patients or the caregivers or whosoever is the decision maker of the patients. Second is the pharma sector. And third is, of course, the ecosystem in which this operates. Now, the moment we look at, the evolution of patients or evolution of decision makers in the pharma industry, we need to be very humble about this fact that digital pioneers, that is Generation Y, and the digital natives, that is Generation Z, is increasingly emerging as a decision maker compared to the digitally struggling and challenged generations like X and baby boomers. And obviously, the digital world consumers or the decision makers, they seek the same level of convenience and personalization from biopharma as they seek from other industries. So on the front of the patients or the caregivers, you will understand, or people who make the decisions, one is, this movement towards the paradigm shift towards more technologically advanced decision makers. If we look at from the pharma company point of view, pharma companies after a long time have come to this humble acceptance that patient-centric value chains are not analogous to patient-centric products. So their attention from just the product has gone beyond both sides, vertically, horizontally, upside, downside, left side, right side. So it's just not about the product delivery that we are talking about, the product as such, but beyond that. And when we talk about ecosystem, again, all the actors have now understood that there's influence of multi-factors: the disease burden, product type, product life cycle stage, treatment type, region, among others that are available. So yes, we rose very late to the idea of patient centricity in pharma, but it's not very late still. The momentum for change has been building. Conditions are now perfect, and certainly ambitious and fundamental reshaping of the outdated processes is due, and we can become more empathetic, impactful, human, and truly patient-centric if we seriously consider all the factors and start working towards it. Well, over to you, Gauravi.
Thank you so much, ma'am, for that wonderful insight. And now we'll move forward to the next question that is directed to Dr. Atul Nasa. Sir, can you please tell our audience what are the various acts regulated in our country related to healthcare and patient safety, and what are the different acts pharma company must adhere to while thinking about healthcare and patient safety?
Thank you. Thank you very much, Gauravi, for a nice introduction. And I welcome each and every participant to this webinar. And also thankful for inviting me as a panelist. See, my experience into regulations for 30 years. We know that in our country, we have got drugs and cosmetics, which are being manufactured by the pharma companies and cosmetic industry. We have got medical devices, which is a very upcoming field nowadays. We have got diagnostics and so on. And in regulations, we have got different acts. Very first act, which is to be implemented and to be followed by any pharma company, whether it is a formulations or API industry, is Drugs and Cosmetics Act 1940 and Rules 1945, which are being modified from time to time. We have got Medical Devices Rule 2017 now, which are being effective from 1st of January 2018, which are well in force. For cosmetic industry, we have got Cosmetics Rules 2020, which are now well in place. We have got Drug and Magic Remedies Act, that is called Objectionable Advertisement Act. We have got Drug Price Control Order. We have got Narcotic Drug and Psychotropic Substance Act 1985. And apart from that, we have got Clinical Trials Act. Now see, India is the pharmacy of the world, everybody knows. In any of the profession, I was just listening to the young speakers just before this our program, they were talking about e-pharmacy, which is a big challenge. And everybody has given a wonderful presentation on e-pharmacy regulations. What are the, issues related to e-pharmacies? What are the, challenges what e-pharmacy has been facing? And I just, for information, I was the member of the committee which was being constituted by Government of India to frame e-pharmacy guidelines along with other 5 state drug controllers. It was a big challenge. So apart from that, any pharma industry, whether it is a drug industry or a API industry or a cosmetic industry or a medical devices industry or a diagnostic industry, they have to follow all WHO GMP guidelines, which are being well in place in the Drug and Cosmetic Act. And it is a big challenge. But on the other side, our country is exporting a huge number of drugs and formulations to the entire world. And we have seen that during the COVID time, when second wave started or first wave started, our pharmaceutical industry has played a very important and vital role. Starting from hydroxychloroquine tablets, PPE kits, life-saving COVID management drugs, including remdesivir injection, including tocilizumab injection, including amphotericin B, which was meant for mucormycosis and black fungus, and then all vitamins preparations, including ginkgo, then ivermectin. Everybody worked very hard. My salute to total pharmaceutical industry. They worked very hard, and I can simply say that India is the pharmacy of the world. But regulation says the main mission of any of the regulation or the FDA or drug control department is to provide safe, efficacious, and quality medicines to all the consumers at the affordable prices. This is the main mission of a drug control department or the regulations in our country. So regulations which are being monitored at the central drug control level and which are being monitored at the state drug control level. Both departments, Central Drug Control Department, CDSCO, and State Drug Control Department at all the state levels are working jointly, but with the different functions. So I will not go in detail the functions of State Drug Control Department or Central Drug Control Department, but main mission of both the departments are providing the safe, efficacious, and quality medicines. And on the other side also, as a regulator, we expect from the pharma industry and the other relevant industry to follow all the guidelines which are well in place in our country. Thank you.
So much, sir, for that information. And my next question would be from you only, sir. What can be the role of regulations to ensure patient-centric treatment?
Very relevant question. See, like I have told you in my previous submission, that the role of the regulatory body is for providing or ensuring the availability of safe, efficacious, and quality medicines, whether it is a medicine or a medical device or a cosmetic or a diagnostic. So to ensure this safety to the patients, what patient want at the end of the day, a proper treatment. And at the end of the day, he wants that the medicines, whatever he is getting from the pharmacies or whatever the medicines he is getting from the pharmaceutical industry or whatever the medicines are getting from the retailers, this should be the quality medicines. So as a regulator, each and every state drug control department, including the central drug control department, are trying a regular checkups on routine basis by lifting the legal samples and the specimen samples and the survey samples and sending these samples to the government laboratories and to the other testing laboratories for the quality issues. There was an information that in our country a lot of spurious medicines or counterfeit medicines are available, and a percentage of these medicines are on the higher side. But later on, National Institute of Biological in 2018 they did a survey. And there was an information that only, NSQ drug that is called not of standard quality drugs are only 3 to 4%. So this is called a faith in our system. This is called a faith in our pharmaceutical industry. Why our medicines are well accepted all over the world? Because they are the quality products. So as a regulator for the patient safety, it is the utmost duty of a regulatory department to see that whatever the medicines are being manufactured, during the manufacturing process, during their transportation process, during their storage process, and during their dispensing process. The samples are to be drawn and they are to be tested at a regular interval so that the patient confidence is to be maintained. Now, if you see the legal samples, which are as per the Drug and Cosmetic Act under Section 23. Now, legal samples, once you draw legal sample from any of the pharmaceutical unit or from any of the pharmacies, they are sent to the government analyst. And if the samples fails, as per the Indian pharmacopoeia requirements or as per the British pharmacopoeia requirements or as per the USP pharmacopoeia requirement, as per the labeling provisions. So action is to be taken against that pharmaceutical company or the person who has supplied not of standard quality drug. And that is the main issue. And then sometimes what we see that once the samples are being sent to the government laboratories for the analytical purpose, sample passes the test as per the pharmacopoeia requirement, but on the other side it is a counterfeit medicine which is being manufactured by somebody else, not by the original manufacturer. So in that cases, specimen samples are also drawn, particularly on the complaint basis. And the specimen samples are being sent to the original manufacturers with the request to verify the genuineness of the product, whether it is being manufactured by their company or not. So issue is sometimes sample passes by the government laboratory, fails by the original manufacturer, stating that it is not our product. Reason being, if you see the chemical analysis and the physical parameters, if I take a tablet, it is a strip form. So once we are taking a strip of a tablet, the physical parameter, font size, labeling, that ink which they have printed is to be, identified by the original manufacturer, which is not possible at the government analyst level. Government analysts only do the chemical analysis as per the Indian pharmacopoeia specification. But physical parameters are being identified by the original manufacturer by comparing them with the original reference standards. So this is a big challenge. But I am very happy to tell you that in our country, quality of medicine, though it was sometimes discussed at a various level, it is an issue, but for patient safety, for patient-centric, we have to provide quality medicines, and India is providing quality medicines. And I'm very confident that our medicines are being accepted by all over the world. And even during the COVID time, we have exported a lot of medicines to the entire world, including hydroxychloroquine tablet, including the all COVID management drugs. So my only submission is, let us join hand. It is on both the sides, whether it is pharmaceutical industry or it is a regulation. Regulator should not act as an officer or as an inspector. He should be just like a facilitator. So once you are going to any audit to the company, or once you are going for any inspection to the pharma company or relevant company, you just try to facilitate them. The fear should be away. The result will be automatically very good. Thank you very much.
Wonderful, sir. Thank you so much for that very informative discussion. And okay, so now we'll move forward with the next question. The next question is for Dr. Sandeep Narula. Sir, can you please explain? In the pharma industry, everybody is talking about digital marketing. How is it going to help the patients and support patient centricity?
Sure. Thanks a lot, �々, for raising this question. I think it is an absolute pertinent question, especially when we were in the pre-COVID period. We used to discuss about that how digital interventions are going to help in the patient and how the patient centricity will become the center stage. So after 2 years of experience, I think we have learned a lot that what actually the digital interventions are and in what way it is supporting the pharma industry, which are the services beyond the pill. So for this, I think it is very important for us that first we should understand what is the digital patient journey. We know what is the physical journey, but in case if we want to understand the role of digital marketing, that what actually is the role of the digital marketing in the patient centricity, then I think it is very important for us to understand what is the digital patient journey. And for this, I will request you that kindly allow me to share my screen so that I can share with the participants that what actually the digital patient health journey is. So let me share screen here. I hope that it is absolutely to all of you.
We are waiting, sir. Now
yes,
it is
sir.
there. Yeah.
Dr. Sandeep, just one request. To save bandwidth, you can stop your video and go with the audio thing.
Okay. Yeah. So here, in case if you see now this, now I'm just giving you an imaginary situation here where a lady is there and she's 36 years old and she is a veterinary and she is working as a veterinary assistant in a large city and she has got 2 children also, and all of a sudden she noticed some rashes on her skin. So she ultimately asked her what these rashes. This assistant immediately, maybe it can be nowadays we know very people might be able to recollect also that how some is so primarily generated by this health voice assistants. Now in this, now the moment these things are here, voice that that in with
Excuse me, sir. I'm sorry, sir. I'm sorry for interrupting. But sir, your network is a bit glitchy. Can you try and switch the network?
Gauravi, I think the network has caused him to drop out. We can ask next question.
Okay.
Yeah, because that was a very interesting case study. As soon as he joins back, we will ask him to share it.
Okay, sure, Dr. Swati.
So am I audible to you?
Yes, Dr. Sandeep, audible. Please share screen again, sir, if possible.
Sure, let me try.
There is the voice is also breaking, Dr. Sandeep. So let's go ahead and see.
I have already. I hope that I have already closed the video. So is it okay now?
Okay. Yes, currently
yes,
okay, sir.
It is okay, sir. Sir, can you begin it from the start only? Because
okay,
voice disconnected a lot. Yeah.
Yeah. So I was talking to you since I was sharing also that how actually the digital patient health journey can commence, and these are the immediately she asked her voice assistant, maybe Google, which is the Google assistant. So here this lady asked from the voice assistant that what are the common causes of this rashes on the screen, and this voice assistant, then she churns out some eczema, dermatitis, or maybe poison ivy, or maybe allergies. So all these results which are there primarily because of the search results which are there, which has been generated by the Google, which is again a digital marketing tool. Now, once all these things are there, and immediately the voice assistant asks that should I raise an appointment with your family physician or maybe with some leading derma? She says yes. Please to raise my so automated schedule system starts working. What we see also that she gets an appointment also with her family physician. This is the point contact number 3, and then she had an appointment. So want to reach to the family physicians. Her week Uber. This is the digital admission point number 2. So she booked a ride and she reaches to the doctor. Now, once she reaches to the doctor sees her and tells her that primarily these are the reasons that you have to take these type of medications. So, also this doctor conducts an allergy test. Now, when she is going back after showing the doctor, then she receives a report online when she is in the cab, and then she comes to know that primarily there are some rashes and the doctor has written a medication. So this is now point number 5, where through the portal app she is downloading the report, she is reading the report, and then so she is sharing through video, through the video chat and through the images. Primarily, it is the development of the disease, sharing with the physician and how it is recovering also. So this is the point number 7. The point number 8 makes a video chat, and the doctor advises her again that since primarily there is the latex which you are using, if you ignore this, then this can be subsidized further. So this, if you see here in all these videos, primarily there are 8 touch points. Now these 8 touch points, one by one in case if you see that the voice assistants, then the search engines, then taking the online appointment, then Ola, Uber booking, leading to the doctor clinic, and then online report portal, then sending the recovery images, the doctor WhatsApp, and then follow you, and then the medication through the online pharmacy. If you see here in one particular, all 8 sources of the digital marketing interventions for any of the company which is trying to reach out to these customers. So this digital marketing tool, as per the own need patient and also as per the need and convenience of the doctors, I think the pharmaceutical companies, they can target these 8 touch points, and I strongly feel and believe that they will be sorted also. So in marketing concept, we call this as the digital marketing, which is a combination of social media, mobile analytics, cloud, and IoT. And if you see here, the pharmaceutical companies, since we are talking about the number of platforms, it can be it can be the phone calls, it can be the social media, mobile, it can be the website, the remote visit, the face-to-face visit, the email marketing. So all these channels or tools or the platforms, we call it as the multi-channel marketing, but primarily it is up to the patient that which channel they would like to use. So in pharma marketing, we will say omni-channel marketing. And nowadays, especially after the onset of COVID, especially during the post-COVID period, the pharmaceutical companies, they are using omni-channel marketing a lot. And to a great extent, they are getting great amount of success also. Now, in this omni-channel marketing, the major advantages which the companies are getting is that it helps to integrate with the target audience through the channels which they prefer. It also increases the consumer engagement and the conversion rates, because these are the interactive mediums and the tools which the pharmaceutical companies are using, and they can set the dialogue with the customer or maybe with the consumer. Also, it helps them to reduce the target the customer acquisition cost, and also it helps them to go for the conversion. Simultaneously, it also helps to improve the pharmaceutical companies that in what way they can set the effective communication tools, whether it is your WhatsApp medium or it is some report which they are asking for through the websites or maybe through email marketing. They can send them what are the reports and the do's and don'ts they can use. It will also help to improve their brand performance once they are sharing with the patient that what can be the possible etiological factors, what are the precautions they need to take. It will help them to improve the company performance and the product performance. It will also help the companies to improve and measure the targeted and specific communication which they are looking forward. It will also help the doctors because all these communication tools in turn they are supporting the doctor also, and the doctor can also save their time, because if the communication is going in two-way manner, then the patient is already aware of, and if that particular communication is also shared with the doctor and from through doctor, it is routed if it is routed through the doctor going to the patient, then the doctor is also assured that the specific and the desired communication is going to the patient. So it will help in measuring the communication tools and the communication strategy. And because of this reason, the doctors as well as the pharmaceutical companies, they can have the loyal customers, which is going to help the company in a long way. All these things, in case if you see, there are various, because nowadays, especially after the COVID, the companies have worked a lot. So there are a lot many interactive there. And if the companies are interested, they can generate the interactive media at all those 8 points which we have just discussed. It can be not only the interactive media, simultaneously, if we are interested, we can use the computer mediated communication also. It totally depends upon that what type of investments the pharmaceutical company is willing to do or they have done. So this was all about the digital marketing interventions, which I hope that I have made my point simple, that how the digital marketing is going to help to the pharmaceutical companies. Over to you, Varvi.
Thank you so much, sir. That was a wonderful presentation. And I believe all of the audience must have learned a lot.
It actually showed, it was all written, though the sound was not there, but everything was written and it was very well elucidated, Dr. Sandeep. There are some issues with your bandwidth. So, sir, I will request you to please keep the video off and let us hear from you both, because that is causing concern here. Audio is not clear. But the presentation was awesome. You made it simple for all of us to understand where are the touch points, where all a company can create an intervention. Gauravi, please go ahead and ask the next questions.
So, Dr. Swati. Okay, so moving on, my next question would be for Ms. Sanju Yadav. Ma'am, since you have been in the sales and marketing department of this industry, patient centricity has been in discussion in pharma for years. And how do you see the current performance in this domain? If you can share something related to that.
Yes, so sorry for the question. Can you hear me?
Yes, ma'am. Could you please just switch off your video? We will be able to hear you better.
Okay. I don't think the video is a problem right now. Can you hear me?
Yes, ma'am, I can. But there's the voice is a little glitchy.
It's a lagging, Ms. Sanju. It will lag. If you go ahead with video and audio on, it will lag.
Okay. So is this better?
Yes.
Yes.
Is it? Okay. Yeah. So thank you very much for the question, Gauravi. And we have had so many discussions around the same. It's a very pertinent question, and coming from the industry, it is actually a question of self-appraisal, right? To really rate yourself whether the industry has done justice to being patient-centric. So I would say that if you look at history, there is definitely a lot of discussion around patient centricity. We do understand the role or the place of the patient in the entire value chain. And it is really good that there is discussion. So the importance of the patient is definitely understood and accepted. Though if we look at the performance on really being patient-centric, I would say that the rating would be quite low still. And as Tanjul said earlier, the evolution of patient centricity, if you see, it is quite recent. And in terms of the marketing efforts, if we see how we have evolved, we have been largely a very disease-oriented industry. So from disease orientation, we went, this will echo. So from disease, you'll have to leave. So from a disease orientation, we went to customer orientation, and then we need to go to patient orientation. So this whole, are you able to hear me? Yes, yes, okay. Audible. Okay, great. So if you look at the communications, what we used to create in the past, all our visual aids, all our communication used to have all the disease forefront and trying to teach the doctor in terms of what the disease is and how the drug is going to act on those diseases. Then this whole talk about being customer-centric came about, and then the whole visual changed. And in our communication, you could see the doctor now. So you could see that, the doctor is very important for us. You are important for us. So we are doing all of this to serve you so that you can serve your patient. So that was the line of communication, which was in the mid. And now, because, as I said, the importance of the patient is understood, you see a shift in communication. Now the patients are there in the communication. So there is patient profiling, but that is not really the core of patient centricity. And that is where we are missing. There is really a lack of, dialogue and a real understanding of the patient. So right now also, we are still looking at the patient journey, and the patient journey from treatment to diagnosis to, so right from identification to diagnosis to treatment to adherence. And we are still looking at the disease as the center point and not really the patient at the center point. And because there's no dialogue happening with the patient, there is no real understanding of what the patient is going through, what are the emotional, physical, social kind of, setup that the patient is in. And I'm sure there are challenges. I'm not saying it is a very easy route, but I think we are on the path, and there are some therapies where it is relatively easier to do it. There are some therapies where it is really difficult to really go into that whole thing. So you look at the categories, some categories are low involvement, some categories are high involvement. So all of those factors also play into role. But what is most important is the ownership of the organization, the ownership of the leadership of the organization to really keep the patient in the center and move the organization around that. So as I said, the rating right now is low, but the future is very hopeful.
Yes, ma'am, absolutely true. Thank you so much for wonderfully putting those thoughts. And we will move forward with the discussion with my next question directed to Dr. Sunil Kanvinde. Sir, would you please like to tell our audience what are the advancements in packaging systems to make them a little more patient-friendly?
Yeah, thank you, madam. Thanks for your question. And I would request you can you please share the slide which I had shared with you?
Yes, sir, in a moment.
Yeah, can you move to the next slide? Yeah, so as discussed on the patient-centric approach, if I really have to look at the technical aspect of it, entire focus is on quality, safety, and efficacy. These are the three pillars, and what regulation believes or what industry believes is these three pillars are supported by an approach, which is called as a risk-based approach. What is risk to the patient? It is not risk to any product or process, but ultimately it should be identified based on the risk to the patient. So based on this patient-centric approach, today when we design a particular dosage form or a particular molecule, we adopt the approach of quality by design. So this quality by design looks at what is the requirement of the patient. So dosage form is based on patient needs, therapeutic dosage regimen, and safety consideration. And these are some of the aspects which I will not go into the detail, but which will bring in the importance of packaging as an integral part of the product. So the development looks at packaging is an integral part of the product. We don't talk about product standalone, but packaging has to be integrated when we look at patient-centric approach. So can we go to the next slide, please? Yeah. Now, second part which the regulation has come out with is very interesting, that they call it as a container closure system. It has to work like a system. So what are the guidelines from FDA? A container closure system refers to the sum of packaging components. So it is not standalone, some bottle or some blister or something, but it also includes primary packaging components and secondary packaging components, if the latter is intended to provide additional protection to the drug product. So it is expected to work with quality preservation over shelf life, has repeatability in usage, because if the container is going to be used multiple times, it has to establish its system efficacy by showing that there is a repeatability. And throughout this usage, it has to maintain the integrity. Now again, this integrity is linked to the quality. And coupled with that, it has to also show the incidence of most important part of patient-centric approach, that is convenience and compliance. So to show this, I will give some examples how the packaging development has proceeded for this approach. So kindly go to the next slide. Yeah, I will show you some of the examples where the risk is covered along with convenience and compliance. So now this is a pack where there is some product which is for a particular therapy and for a particular age group. So to prevent any wrong usage, to avoid any risk or overcome any safety issues, if you see, this pack is developed with two areas where the person has to push, and probably a particular age group will be able to understand this. So in order to remove the blister from the pack, there is provision for a particular area where you have to do the push, and it is further protected by two areas. So making it further difficult to remove it. So it prevents some misuse by children. So this is one example where the packaging development is aiding to a patient-centric approach. Next, please. Now, another area today, if you see, is really the concern is child-resistant packaging, because there is a lot of issues related to the molecules where the focus is more on developing potent molecules. Now, these potent molecules are molecules with narrow margin of safety. How to safeguard this interest? So I have shown three blisters here. Now, first, if you see, general approach is by quality enhancement by metallic band. So if you see, these packs are purely made out of aluminium, which is providing a barrier to moisture ingress inside the product. Now, if you see the first picture on the left side, the blister is peelable blister. So you cannot push the product through, but you have to peel the covering of the tablet or capsule in order to remove the tablet. Thereby, it is making difficult for children to remove. So this is one of the example of child-resistant pack. Now, what FDA is doing is, before they give the permission, they evaluate the particular category and they insist that it should be a child-resistant pack. Now, even if this is not sufficient, there is a second level of protection, which is shown on the right side. That is called peel and push blisters. So you have to first peel the upper layer and then you have to push the product out. So that is providing additional protection for the safety of the patient. And overall, if you see, there is a combined development on all this pack, and it is called unit dose blister. So each individual blister is provided with a perforation. So when the patient wants to carry a tablet, because his dosage regimen is that he has taken one tablet before he moves out of his house, and he is expected to take it during the hours when he is outside the house, then he doesn't have to carry the entire blister, but he can take one blister because of the perforation, carry with him, and then take the dose when he is taking. So which is significantly increasing the compliance aspect of the approach to the patient. The next slide.
Sunil sir and Gauravi, sorry for disturbing the flow, sir. I received a message from Dr. Atul Nasa that he has to leave for some meeting. So just thanking him. Thank you, Dr. Atul, for being here and answering the questions asked to you. We really thank you for...
And in case of any query, anybody can mail on my personal email ID, atulnasa@gmail.com.
Sure. Thank you. Thank you, Dr. Atul.
Okay. Thank you very much. Thank you.
So much, sir, for joining us.
Dr. Sunil, thank you for giving us a pause. Let us go ahead, sir. It's a very interesting thing that you're showing.
Now I will go to the another dosage form which is coming up, and that is the bottle. Now, typically when we took any dosage form, we had long experience that we have to squeeze the bottle and then administer the dose. Now here if you see this pack, which is a nasal spray, there is a collar provided on the top, which is aiding the administration of the dosage. And again, I repeat the word container closure system. Now, what is the beauty of this system is, if you see, this is a 7 ml bottle. And in that 7 ml, there are 70 doses. So what the FDA expects is that you show the repeatability of this container, this dispensing system, that 70 times if you remove the dose, it will first of all give a same metered dose, because it is a very potent medication. Second feature of this is the collar which is provided for the spray is aiding ease of spray. So one person doesn't have to squeeze the bottle where there could be variation in pressure, or because of the age or because of certain medical condition, the person is not able to dispense the medication properly. So this is one of the significant advancement in dose delivery, which is coming to the aid of the patient in getting accurate dose for a severe condition. And even a small dose, 70 doses of a 7 ml. So you can imagine the quantity, and which is accurately administered to the patient for 70 times. So there is no variation in the dosage administered on all the occasions, and only after verification of this, where I mentioned risk. Risk assessment is an important aspect by any FDA before giving the permission for such developments of packaging systems. So here what is evaluated is that every time the quantity of the metered dose which is coming out is actually qualitatively calculated, quantitatively calculated, and then only such dosage forms or such packaging systems are permitted for usage by the patient. And I would go to the next and last slide to give one more example. Where the approach is another example, this is for geriatric patients. So if you see, the blisters are packed in a cardboard boxes, and on those cardboard boxes, if you see, there are mentioning of day and night, and also there are numbers. And another part of is that if you see the reverse of this cardboard box, then you will have all the details about the product, administration, storage conditions written in bigger fonts, so that the patient is able to read them without any disturbance. And even if he is an aged patient, he is able to understand the instructions. And what is happening is that because the blister size is bigger, he is also able to handle the blister in a proper way. So this is one of the recent development for some potent drugs, and especially for geriatric patients who have difficulty in handling the patient product. So these kind of advancements which are done by the industry and which are supported by regulatory authorities, because they also incorporated various rules. What they have done is they have decided on what should be the font size of the letters, in what minimum font the instruction should be displayed on the pack, so that the person is able to read them and thereby have a better convenience and compliance. Next, please. These are another examples where you find that there is a brush at the beginning of the tip. So when you are applying it to the skin, a known quantity of solution will come out on the brush and then it can be applied to the skin. The one on the left side shows a bottle where the person takes a dose and then he moves the knob. So he knows that he has taken 1 dose and 3 doses are pending. And then there are some packaging materials developed which glow in the dark. So it facilitates a patient to trace. Suppose he has placed the pack somewhere and is not able to see it, then he can readily, they are visible and they are traceable to the patient, and then there's a lot of convenience and prevention of any missing of any duration of treatment and increasing the compliance. So these are a few examples I just wanted to show you that how pharmaceutical industry is supporting a patient-centric approach for various dosage. Thank you.
Absolutely wonderful presentation, sir. Wonderfully explained and illustrated. Thank you so much. So now we'll move on with our discussion.
Before that, Gauravi, I really thank Dr. Sunil for showing all those slides, because these were means they are going on in the industry, and many of us are not aware where all interventions have been made. So thank you so much for illustrating them for the audience today.
In fact, one comment from my side.
Yes, sir.
Sunil sir showed us a peeled blister pack. I do not know what could be the cause of it, but I think this is an excellent packing to prevent counterfeit drugs from coming into the market. I think apart from being child-proof, this is one more application which I see in this peel-proof packing.
Yes.
That's what I wanted to say.
Yes, sir. Your comments are correct. This is also one of the measures for anti-counterfeit.
Thank you.
Okay, thank you so much, Vivek, sir. Thank you, Dr. Swati. So we'll move on with the discussion with my next question directed for Dr. Sandeep Narula. Sir, can you please share with our audience about how personalized medicine will help in attaining patient centricity? So your mic is on mute. So it's still on mute. You can just unmute yourself.
Yeah, so now I have done. And kindly allow me to share my screen also. Yeah, it is there. So here I will show you also that what actually, since you have talked about the personalized medicine, the main thing which I would like to inform you about the personalized medicine is it is quite simple, and even a layman also can easily understand what actually the personalized medicine is. Personalized medicine is also known as precision medicine, and also it is a medical model that separates people into different groups with respect to all the medical decisions, practices, interventions, or the products which we are trying to give to the individual patient based on the predicted response or the risk of the disease. And in this, what actually we would like to, I would like to explain you also that first one is phenotype. Now the phenotype is one thing which, and we as an individual human being, we all have got this phenotype. Now phenotype, it talks about that what is that which is there in my genes, and simultaneously what are my likes, dislikes, and all these things are there. So in human body, there are two things. That is, first is the phenotype, and the second one is genotype, which talks about the genetics. Now, this precision medicine, primarily it focuses very clearly on both the aspects, that is phenotype as well as genotype. Now, in the phenotype and genotype, whenever we try to identify with the help of computer, now since artificial intelligence is helping us a lot, so what we have done, since majority of the records now they are moving to the electronic medium. So here the scientists who are dealing with genomics, what they are trying to do, they are trying to study the various medical records, and they are trying to make a comparison of the phenotype and genotype, and there they are trying to understand the disorders. Because of this reason now, the scientists, they are in a better position to equate that in case if this type of behavioral disorder is there, then what is the type of the disease or for which the patient can land up after a period of time. So this phenotype combining with this genotype, because phenotype tells you about the behavioral aspects and the lifestyle of the patient, the genotype, it talks about the genetic aspect of the patient. Because of these two ends, the scientists, they are able to match, and hence they are in a better position to stratify the need and the behavioral aspects of the patient. And that is what actually we are talking about, that what actually the medical decision practices and interventions can be. So here, in fact, in USA, there is a concept now which they have come up, which is known as iron triangle. Primarily, this iron triangle, it talks about that how the phenotype and genotype can be made accessible to the patients. It talks about the accessibility, it talks about the quality and the cost. Now, since we are in a position to identify and understand the specific disease, so here, in case if you see what we do in artificial intelligence, primarily we try to focus on the various behavioral aspects of the patient, that is the phenotype, combine it with the genotype through the help of deep machine learning tools, and then we try to develop a model, a treatment model for the patient. This is very beautifully explained in this book also by 𝗍𝙗𝙗, which is, and the name of this book is Deep Medicine. So here, in case if you see in these slides, primarily what we are trying to say here is that every individual through phenotype, it is absolutely different. But what we do, we try to identify this gene sequencing, and through this gene sequencing, when it is matched with the behavioral disorders of the person, then the cluster is obtained, and these clusters are being targeted to the specific individual of the patients. And this helps the people to identify that the person who is there, to which medication the person is going to respond. Good number of chances that this red cluster is not going to respond to this blue cluster. So the medication which we are going to define and identify for red cluster of patient will be absolutely different with this blue cluster and this yellow cluster. So here, this medication which we are trying to give and develop to the people, it will be very specific, it will be very targeted, and hence because of this reason, the patients are going to respond faster, their recovery rate will be much more faster, and over a period of time, we are anticipating also, like 𝐿, what already they have done. They have gone for the mass customization. I am anticipating and I am expecting also that over a period of time, today the disease is purely customized, it is individual, where we are seeing that N is equal to 1. Over a period of time, if this 𝐿 model is replicated in this genomics area also, I strongly feel and believe that the mass customization is not a distant reality for the people who are there in the pharma and in the medical business. So this is what actually we are anticipating in the days to come. The precision medicine is going to come. The precision medicine is exploring in the various branches also, along with the genomics. The people are also talking about the phenomics, then exposomics, then metabolomics, proteomics. All these things are there, and blood and here our own blood, our own blood samples are going to play a very important role. That how the biomarkers are going to come, and they are going to come to the rescue, and they will guide you towards what kind of medication the people is going to respond, whether it is allergic or non-allergic, and how it is going to come. So this is all about this precision medicine, which I thought that I would like to explain to the target audience. So over to you.
Thank you so much, sir. Thank you for this wonderful presentation. and it is very beautifully explained. Okay. So now moving on, my next question would be for Dr. Sunil Kanvande. Sir, apart from the marketing, what are the measures that can be taken to provide better services to the patients, and what are the regulatory challenges in the new packaging system development?
See, I repeat what I told first of all. The approach for development, which is adopted by industry and which is also expected by the regulatory authorities, is design of packaging system is an integral part of product development. So you cannot develop a product in isolation and then look at the packaging system. So the approach starts right from the beginning. When the product is being developed, the quality by design approach also takes into consideration the packaging system. And secondly, it relates from plant to pharmacy. So can you just put my slide, please, so that I can correlate to what I explained. Next slide.
I hope the screen is visible.
Yeah, thank you. It relates to plant to pharmacy, supply chain, and set of previous. So it relates to plant to pharmacy concept of supply chain and also set of variable environmental conditions. Because when we manufacture the product or we develop the product, we are in a very controlled environment, which can be defined at design state, that we want a particular humidity, we want a particular temperature, and we want a particular methodology of processing times, processing conditions. But that does not end here, because the product has to move. And as we are saying that India is the global pharmacy of the world, it simply means that the products which are manufactured in a particular place are going to travel miles together before they go to the customer. So here, how this is approached is, first of all, container closure system is considered to be specific to dosage form and also to the global supply location. So for this, how the approach is that the global supply location, that is the entire globe, is classified into 4 climatic zones. This is an initiative by regulatory authorities and also various world quality programs. So based on where is your point of supply, you readily know that your product is going to be in temperate climate, cold climate, humid climate, or hot climate. So when this classification of zone is known, you approach in development of your container closure system based on patient requirement and also dispensing practices. So what are dispensing practices? If you go to a market like US, the pharmacy typically gets a bulk container, of 1,000 tablets or 2,000 tablets. And then these are dispensed as per patient requirement into smaller bottles of 30 tablets or 60 tablets. So every time the bottle is opened and the tablets are dispensed, they get exposed. So this necessitates the use of various moisture absorbing substances like silica gel, protection from any distortion like cotton plugs are inserted or rayon plugs are inserted, so that to prevent any friability issues or breakage of tablets. So these dispensing practices play a very important role in also designing a container closure system. So this is one of the regulatory challenges. Now, control of regulation has 3 dimensions. One is the packaging practices. Second is safety, where I discussed and showed you some examples of child-resistant packaging. And third is what are the storage conditions in that particular country of supply. So control of regulation has to follow 2 guidelines. One is the country of manufacture and second is country of supply. So these things are also driving regulatory challenges. And safety related to misuse and overdose. where you have to control the quantity of a particular medication in a particular pack, where you will find that some countries will not allow multiple packs. Like in India, you get a blister pack, there are 10 tablets and there are 10 such blisters in one pack. But you will find countries asking only for one blister in one pack, so that the patient does not get more than one blister at a time, which can be easily regulated by the pharmacy. And also, when you are giving packs like bottle packs, then what is the quantity of maximum number of tablets which can be added in that bottle packs, which is correlated to misuse, overdose, and also stability of that particular formulation. So when we design these particular aspects, it is essential to consider these multiple challenges, whereby you have to submit this data to the regulatory authorities, show sufficient data to establish quality, safety, and efficacy, which are repeatedly said by FDA that these three aspects you have to establish, and that is again based on risk-based. So if you go to the next slide, I just wanted to show you some technical approaches where we talk about quality target product profile. So when we design this target product profile, we consider various aspects. Now in this, I will not repeat all the things, but if you look at, apart from dosage conditions or kinetics, there is a lot of importance given to areas like impurities. Like recently, we read about ranitidine having impurities, and it created a lot of problems because of those impurities were found to be carcinogenic. So at earlier stage, only the impurities are given a lot of importance, that whether your design, whether your packaging system is contributing to this impurity. Because there are very important case studies where even the plastic bottles or the glass containers which are used for storage have leached into the product and have created impurities and safety concerns to the patient. So to that extent, this quality target product profile is analyzed at a development stage, and some CQAs, what is a critical quality attribute. So it is like assay, which is related to efficacy, impurities, which is related to safety. CU means content uniformity. You know, every dosage what is manufactured has got same content. It is again related to efficacy, and dissolution, because if the drug doesn't dissolve in the body when it is administered, then it is again related to efficacy. So this is the approach adopted by industry, and this is the approach expected by regulatory authorities for any marketing authorization. So this is in brief justifies what industry is making the effort and how regulatory authorities are also ensuring that it is targeted towards safety of the patient. Thank you.
Wonderful. Yeah. So, Dr. Sunil, you are showing us also and speaking also, that is actually making it clear for every one of us to understand this better. Thank you so much, Dr. Sunil. And let me ask this next question quickly to Dr. Tanjul Saxena. Ma'am, if you can tell us what are the drivers of patient centricity in the pharma value chain?
Thank you for this question, and I am switching off my video because of the low bandwidth. I hope it's okay. And
yeah,
am I audible? Yeah.
Yes. Yeah.
So to be very honest, I have been very engagingly listening to the Gullivers in this panel, and this makes my task, which is a Lilliput task now. So amongst the Gullivers, the Lilliput is now able to very easily capture everything that they have said and transform it into the vocabulary of the question asked. Honestly speaking, whatever we have talked about so far, everything is pointing out towards the drivers of patient centricity. But just to wrap it up in the sense of, talking about the drivers academically, because I come from an academic background. So like we heard Dr. Narula talking about the foundational factor of technology, rapidly advancing technology is one of the leading drivers. Whether it is Internet of Things, or it is blockchain, it is artificial intelligence, or it is deep data mining, everything is pointing out towards being the, one of the most important and most pragmatic driver of patient centricity. If we look at from the pharma company's point of view, which Sunil sir and Atulji have been, elaborating from the point of view of packaging, regulatory, etc. We should be we can always summarize it as, there's a paradigm shift now occurring from a focus on profit to one that considers how that profit is made and used. Also, the recognition that the industry needs to build trust with the providers and patients before it can become truly patient-centric and create additional societal value. Now, this paradigm shift is really very promising, and it is promising in the way of pointing out that the pharma sector is very serious about this patient centricity. It has emerged and it has now come to stay. I was very appreciative of Ms. Sanju's honest confession in the panel, saying that if we look at the status, it is not very encouraging. Agreed, but I would also, since I come from academia, I would like to point out certain things here. There have been a very focused group study, and some of the highlights of the study are very encouraging. For instance, it was found in the study that for clinical trials in particular, expected benefits, if the company is patient-centric, there's faster trial subject recruitment, there's improved subject retention, there's reduction in number of protocol amendments, there's lower cost and increased ease of study. Like Sunil sir pointed out, when we talk about design of drugs for a specific patient populations, such as children and the elderly, when he was talking about all those packaging, and taking care of, consideration, ease of swallowing, dosage frequency, combination drugs, and then, ease of taking out, ensuring that it is safe for children. So these actually improve the efficacy of the drugs, which further builds up the trust in the mind of consumers. That means it's just not increasing patient expectation, but also increasing patients' faith in the pharma company and not taking it as on the other side, but rather on being the same side. So gradually developing or the newly evolving new sites and models of care, new way pharma companies are new ways the pharma companies are approaching patients to include advocacy groups, support, involvement, patient advisory panels, social media, online engagement. So these are all pointing towards drivers of patient centricity, which are very promising and which really can give us a line of sight, which would be truly in the letter and spirit, bring patient centricity as the focal point for the pharma sector. So I guess I should stop here. And
Dr.
really
Sanju.
good role is done.
Dr. Sanju and Dr. Sandeep and Ms. Sanju also, after listening to all, I have one question. Which would be the top driver? What do you think is the top driver for pharma to adopt patient centricity today? Because whatever we have heard from the last 2 days, it's all about tech driving the pharma to just, fasten its space in its approach, any approach for that matter. Yes, Dr. Sandeep.
Yeah, here since we are working here with the pharma companies also, the first and foremost thing which is going to set the tone for the change is the leadership capability. Unless and until the pharma top leadership is not committed, today what these are saying, oh, COVID is over, theek hai yaar, normal hai, so go back to the physical mode. So this is what actually the serious challenge is. And since unless and until the leadership is not committed, and that is the reason she is saying also, Sanju has also said that primarily the pharma is not so much open and keen today. Barring the top companies, in case if you see their commitment towards the digital infrastructure, it's itself a huge cost. and still they are in the wait and watch mode. Let me see that how the multinational counterparts are doing, how much investment they are doing, and what type of ROI they are getting. And once all these things are there, then ultimately it will be the learning lessons for them, and based on this, then they will move forward.
Perfect. So, Dr. Sandeep, I agree with you. This is a pain point still discussed within the industry, outside the industry also, and at our forums also. And I completely agree. The leadership and management has to come to terms with what has happened in the mobiles of the people. Means they themselves are using the mobiles, using technology, but they're not understanding that where pharma needs to adopt it quickly. So thank you for putting that point for us. Dr. Tanjul, would you like to add something, the top driver?
Actually speaking, the moment you put the question, the inner voice that came out was exactly this. It's the intention of the pharma companies, and with a very, very humble appreciation that the profits need to move in the right direction of understanding the patient at a DNA level. And we really cannot do away with not including patient in their own journeys. As Dr. Narula was pointing out towards the 8 touch points of the digital journey, not only the digital, but otherwise also the patient journey, every point I think pharma needs to be very sincerely looking at their needs and including the voice of the patient. So I guess I stand by him.
Thank you, Dr. Tanjul. There's another very interesting question that has come up, but I'll first of all let Gauri conclude this faculty, and then I'll ask another question here. Yeah, over to you, Gauri. I think that's the last question for the faculty panel today. Please.
Yes, Mr. Swati. The last question, but not the least, it's a very interesting one, is for Ms. Sanju. Ma'am, would you like to share what are the key challenges that we have to overcome in order to move forward with a patient-centric approach in pharma?
Yeah, so thank you. I think the discussion just moves ahead of what we've been just discussing. And my job has been made very easy by Dr. Tanjul, because she has spoken about the drivers. And Dr. Sandeep has also highlighted that one of the challenges is that leadership intention. So how I'd like to put this is that there are basically some external factors and there are internal factors which are major challenges as of now. In terms of the external factors, technology is one very, very important one, that we all understand technology, but the adoption is not very good in pharma. And moving towards precision medicine or using AI to really understand the patient voice. So right now the patient voice is not in the boardroom. So in the boardroom we talk about only profits and the disease and the treatment and all of that, but not the patient voice. So using technology to get the patient voice in the discussions in the office, that is one very big challenge. Number 2 would be to really understand the patient experience and keep that as the core outcome for which all of us are working. So if that is also, it comes, the whole discussion and the collaboration that is required for that will be across organization. So it will not be just a bandwidth of the marketing organization to really think about patients, but it will, really pass through all of the functions, right from the manufacturing to the delivery, sales, medical. So much better collaboration is required. And we saw examples of packaging where the patient-centric packaging is being used. But if you see what actually happens, these are the feedbacks which comes from the marketing, then it is sent to the manufacturing, these ideas come, and then such packagings are introduced. An ideal way would be actually that if the patient voice is shared by everybody, so if everybody listens to the patient voice, then people can work in their domain to serve the patient. So the packaging department can themselves, because they understand that disease for which they are packing, they understand the patient who is suffering from that disease and how a packaging can help. So each department can really add so much value to that. So that is around use of technology. Then the second challenge I see externally is, of course, the lack of trust for the industry which is there, and it is really true because of the actions, and you hear about litigations, you hear about all those sinister plays which happens behind all these big decisions. So how will the public trust? And I think that's an area that really everybody has to work, because you're talking about patient who is a part of that public only, right? So that mistrust is very, very important to be worked at. Again, leadership would play a key role. And the regulatory environment, there is a huge fear of regulation, and that fear really stops innovation. So that is also something. Of course, it is not as easy as, it is easier said than done, but a discussion across the organization around the challenges from regulatory policy and all of this, there are windows of opportunities which will definitely come out, which then, the people can work on. So these are the external factors. Internal factors still remains, number one is the mindset, to really get the patient voice in discussions. And for that, marketing team, sales team have to go and meet the patients. The medical team along, everybody has to really see the patient, understand the patient. As I said, it is easier for some therapies, more difficult for the other therapies. Mindset, ownership of the leadership, very important. Collaboration, very important. And I think one of the challenge which is there, why this is not happening, because the intention is there, but there is a difference between the the lip and the cup. And I think one of the challenge is that it is very difficult to link business results with all these efforts around patients. So all the patient-centric efforts, very difficult to link business results on a short to medium term. Long term, everybody understands, but then there are pressures and all of that. So I think this is a very, very big challenge, and that is why resources do not get allocated also for the work to be done around patient centricity from each of the departments. So I think these are the various challenges, external, internal, and if the company is really committed, of course we are moving ahead, but the pace can definitely be much better if more work is happening on this to combat these challenges. Thank you.
Wonderful. Sanju, actually you summed up everything what has been the talk of the town. Vivek, sir, your comments here, because you were listening to all of this, and what do you feel after hearing the faculty here?
I would like to echo what Dr. Sandeep has said, but I would like to be a little more vocal. Whereas in India, the leaders are basically the owners of an enterprise. Whether it's a CEO or whether it's a senior vice president or the executive vice president, they really don't have much say in the policy making. When Dr. Sandeep was talking about the change in leadership, talk about leadership, I would rather say a change in the mindset, the change in the mindsets of the entrepreneurs that is required. However, whatever be the intent of the CEO, whatever the intent of the senior vice president or the executive, but if the owner of the company, the owner of the enterprise, his mindset is still of the 1974 mode, this will never happen. Fortunately, what is happening in the multinational companies, they are getting their directions from the parents abroad, and that is why they are able to bring in some kind of centricity in today's marketing. But unfortunately, what I've seen about the multinational, many of the things they say on the websites, websites are beautiful, but when it comes to action, there is no match. I'm sorry for being a little vocal, but since we are only 76 people left and we are all senior people, I thought I must open up.
Thank you, Vivek, sir. You have been vocal about it for the last 3 years that we have been doing this World Pharma Brand Managers Day online. And yes, thank you so much for emphasizing the need of the hour. If tech is not the force, then maybe doctors would be the force, but pharma industry is slowly changing. And if doctors ask for digital things, then again, pharma has to change as per the needs of their
Yes,
yes,
we have to listen to the voice of the patients. We have to listen to the voice of the patients. And without boasting about the Pharma State Academy, let me say, for these 3 days, we have almost 32 interviews between the patients and our team. 32 interviews. But because of the paucity of time, maybe we'll be able to show hardly maybe 15 or 16 of them. But we have shown the way to the pharma industry. Sorry for being, a little, what I would say, boasting about myself or else boasting about Pharma State. Sorry, Swati, she doesn't like.
No, makes sense. You get your we are a platform of luminaries, esteemed members from academia and experts from industry, and what they feel that we echo. Dr. Amit, would you like to interact? Satish, if we can let him speak on the topic. Please unmute.
Hi. Can you hear me?
Yes.
Okay. Hi, everyone. And as always, Pharma State Academy, thank you so much for holding this very, very relevant meeting. And at the outset, I'd like to congratulate all the speakers, including the ones from NMIMS. All of them were exceptionally good. And one special compliment to all of them. They really know how to make their slides, and they do not put their entire text matter on the slides, as most people in the pharma industry do. Okay, so I'm so glad that the future generation is ready for making proper presentations the way they are supposed to be made. Anyway, coming back to the main issue, Vivek sir, I completely agree with you. What is there on the website and the action at the ground level, there is no match. You're absolutely dead right. I just want to highlight one thing which unfortunately has not got highlighted. There are two types of patient-centric pharma companies. Those companies which have religiously followed Professor Mitra, which we started the session with, they are entirely pharma-centric. They are taking the data from the patient and making their marketing strategies absolutely flawless. They are pharma-centric, they are patient-centric. The other patient-centric is what we are concerned with. What Professor Mitra made the Indian pharma industry is not the patient-centric that we are talking about today. We are talking about giving something to the patient, not taking something from the patient. And that giving is in terms of good medicines, relevant medicines, not just another. I mean, we've got 20 ARVs, so we'll market all the 20 ARVs because the owner of the pharma company wants to make profit. That's a separate objective altogether. That's great. That is also very relevant, but that is not patient-centric. So relevant medicines, that is what I mean. Also good quality medicines. All this thing about e-commerce, that's fine. It's a great business opportunity. People will make money and it's a convenience to the thing. But the spuriousness of the drug is definitely not going to get resolved. And it's only going to get compounded for the simple reason that there's currently no regulatory mechanism to check the actual medicines which are being stocked and delivered by the e-commerce thing. So, I mean, I know the regulators are on the job and I'm sure something will come up eventually. But this one claim made by, I think, one of the students from NMIMS that, one thing associated with e-commerce is safer medicine. Sorry. It is safer right now only because e-commerce is 5% of the entire retail industry. Wait till it becomes 95%. Then you see the menace of spurious drugs. And that is why retail has that menace and e-commerce right now does not have that great a menace. So please do not be under the misconception that e-commerce and e-tailers are necessarily associated with safer drugs. And lastly, something that Swati has been alluding to yesterday also and today also, we have to give the patient in a language that he or she understands. And for that, we have to take it to the doctors first. We have to educate the doctors to talk the patient's language. He's too busy. He has his own language, which he has been talking for the last 30 years. He cannot change. He can only change if we help him to change. So all the communication to the doctors and then to the patient, that's a separate channel. Both have to be in a language that the patient understands and identifies with. So the only stumbling block, this is one of the questions you just asked, ma'am, there on the screen, that what is the stumbling block for becoming patient-centric? There's only one. It's a mindset of the company owners. Otherwise, there is no stumbling block. Even 20 years back, 30 years back, when I entered the pharma industry, I could have made the company patient-centric without technology also. Technology definitely helps. I'm not saying technology is irrelevant. It is very relevant. It expedites things. But even 30 years back, 35 years back, we could have been patient-centric if we had really wanted to. So the want, the will, the mindset is all that is required for this. And please differentiate the two patient-centrics. It's not about collecting data from the prescription-based analysis. That is not what makes a company patient-centric. We already know what the patient wants. There's no rocket science there. And we have to deliver it as a pharma company. So I hope next 20 years, some changes will happen. All the best to all of you, and thank you for listening to me.
Thank you, Dr. Amit. Very relevant points you have made. And yes, what patient expects, I would just within few seconds tell you, in the last day, a patient spoke about his expectation, and his expectation was getting a wonder drug for diabetes, which can be taken once in a day or once in a week. So that is the expectation today the population has from pharma, and I hope we live up to that. Mr. Amninder, you want to discuss something here?
Yeah, hi, good afternoon, everyone, and good to see the charming faces. Nice to meet Dr. Sandeep with face. So my question is, health technical assessment, the pharmacoeconomics, do you see that as patient centricity, and why pharma companies are not conducting those kind of studies, when it comes to health technical assessment? We have now Government of India HTA centers which are available, where exact economics of value is generated, whether this drug is beneficial or not. Hello, Swati, could you hear me?
Yes, Mr. Amninder. So you want to ask this question about the health economics?
Health technical assessment, yeah, health economic studies which are there. Why pharma companies are not conducting those studies, or why government is not insisting on that, whether a particular dosage strength or formulation is cost effective. For example, I give example in terms of oncology. Many times the vial is of 200 milligrams, out of which only 180 or 160 is utilized by the patient, because as per the dosage, 30 or 40 goes waste. So does it make sense to come up with a 200 milligram vial, or should we come up with multi-dose or a lower SKU vial which could save that much cost of medicine wastage? This is just one example. There are so many other examples in terms of dosage and other things which are there. So my question is, where is the will in terms of from the government to put it for health technical assessment studies for pharma?
Yeah, would any panel member like to take it? Because Mr. Amninder, I think the person who would have taken Mr. Dr. Atul Nasser is not in the panel currently. Dr. Sandeep, would you like to say something?
This is where actually when the point when we were talking about the precision medicine. Now, since it is now the subject is just in the evolving stage, and the companies slowly and gradually they are trying to change their medical regime also. Since initially if we would like to serve the individual serving, then obviously it is going to be more costly as compared to the normal daily dosage which we would like to have. So here the companies have already started working on this, and I strongly feel and believe that it is just a matter of time only. Because as I said, that in the precision medicine, based on the body weight, based on the requirement, that how the stratification can be done and the dosage can be served. So since already I opted out and also I talked about the mass customization. So pharma industry is just in that particular stage only, and thanks to Industry 4.0, where all these things are slowly and gradually they are falling in place. But it is going to take some time. We have already identified, we have already seen also that how much wastage is there, then how much out-of-pocket expenses the patient has to incur. And trust me, this breakage, expiry, and this loss of medication by all these factors is certainly putting an extra burden on the common patient. And this is what actually the government of India is also trying to work out, that how the individual therapies can be passed on to the people. Slowly and gradually these things are going to come, but it is going to take its own time. It doesn't mean that the government and the policymakers, they are not aware of, or the pharma company is not aware of. They are already aware of, and they are also highly sensitive towards all these cost issues. But since it is a policy decision, and the government of India also, they need to take at the top level whether the single dose should also be allowed to pass on to the patient. So I think it is just a matter of time where the things are working out, and I strongly feel and believe that the things in the future, at least, we are going to see that the dosages are served in this manner.
Another question, just which is there is, in fact, 2 days back only it was there. Many companies are now coming up with higher number of tablets per strip. So like, from 10s they're going to 30s. Now, sir also had commented on that. Do you consider this as a patient centricity, because the intent is that they will take the full 1 month course, or it is profit center because you're pushing 30 tablets at one go to the patient?
Vivek, sir, I would like you to respond.
I'll give the same answer which
I know, sir.
When we talk about patient-centric packing, for example, azithromycin, till about a few years back, which first
we lost you.
Yeah, now it is there.
Sir, can you just repeat? We lost you.
Okay, what I said, that when azithromycin was introduced in India, maybe about 20 or 25 years back, the pioneers, I don't know whether Sanju was there at that time, but the pioneers like Alembic, they came out with just 3 packs, 3 tablets in a strip, because the dose of azithromycin was just 1 tablet once a day for 3 days. And even today, PDR, Physician's Drug Reference, says that in most of the infection, the dose of azithromycin is 1 tablet 3 times a day. When our pharma marketeers found that the drug is stagnating and there is no further scope for growth, how do I increase the sales? The pressure coming from the entrepreneur. How do I increase the sale? Simple. Change the strip of 3 into strip of 5 tablets. Now, what is the purpose of those 2 extra tablets? That is what Amananda says is totally profit-centered. But many years back, I think it was in the 74 or 75 when I just started my career, there was one hematinic for the gynec, for the women who were pregnant. It was called as prenatal capsules. Prenatal capsules was originally available in strips of 10s, but then they found out, the company found out that patient compliance, the ladies' compliance is very poor. So they introduced a pack of 120 tablets. That, I would say, was a bit of patient-centric because it ensured patient compliance. That's my take.
I totally agree. So in fact, I have another viewpoint. If a bulk pack comes at a discounted price, I think it is still a patient-centric. So if 5 tablets would have been economical, then buying 6 tablets, I think that is still, you can say, a centricity of patient economics is there. But yes, it is more perceived as profit center because you're trying to push more units to patient in the first, at every transaction.
Thank you, Mr. Amrinder, for asking those questions, and thank you, Dr. Sandeep and Vivek sir, for answering those. We are receiving a lots of questions. Majorly questions on the role of e-pharmacies, replacing pharmacies, replacing medical reps, and all those things. Requesting you to please park those questions for a very relevant discussions later in this year. We will bring that to the fore as soon as some regulations are in place about that. And we will discuss it out vehemently during the session as we always do. Let us thank our faculty panel members, Gauravi, and all the panelists who joined us today and the team before we log off. Yeah.
Swati, I would like to just take this moment and thank everyone, like sincere gratitude for all of you. You came and joined us for this event today, and you all put a lot of effort and researched a lot of content and putting up such informative discourse for our audience. Thank you so much, everyone. And I'm sure that the audience must have learned a lot of valuable lessons from the whole discussion. Okay, with this, we have come to an end of to our day. And before we leave and get going with our own busy lives, I would like to thank each of the panel members and participants for their presence through a video.
Yeah. Please stay there because I'll be telling about the day tomorrow. Before signing off, let me invite you to tomorrow's session. It is going to be a long session, so please be there at your preferred time. It will start at 11 and it is going to be around 6 to 7 hours because we are going to discuss therapy-wise the patient insights through videos. We will be hosting the event at 11. Same link will work. So if you have the link, it is the same link will work for tomorrow at 11. We'll start with Dr. Sanjay Mitra, then Mr. Sanjeev Navangul speaking, and then we have Dr. Bansi Sabu also speaking on pre-diabetes to diabetes. After those speeches, we will be moving towards videos where we will touch upon first diabetes panel with Dr. Ashok Bhattacharya, Mr. Sachin Bodawala, and Mr. Alhad Mahajani discussing on the insights generated from patient videos on diabetes. And post that, we move towards the gynecology panel with Mr. Sharik Khan and Ms. CG joining and speaking on insights in gynecology. Then we have dermatology panel with Mr. Hariram Krishnan and Sankar Das talking about derma insights. And then we will have onco panel where our own Vivek sir, Vivek from AstraZeneca, Dr. Ulhas Ganu and Mr. Amrinder would be joining to do the insights. That would be a wonderful, wonderful day for every therapy area marketing teams. Be there, join us tomorrow, and bye for today. Thank you for joining us today. Signing off.
Thank you so much, everyone. Thank you so much for sharing your time and day with us. This is Gauravi signing off. Have a great day ahead.
Yeah, and we are posting a link in the chat box. So if you got time, please fill the feedback form. it will really help us in bringing better sessions with your feedback. Yes. So you can click on the link posted in the chat box and can leave the meeting in this way. And we'll just close the session in 15 seconds. You can click on the link in the chat box and then fill the form, and we'll end the session. So we are ending the session. Have a lovely day ahead. Bye.
Happy Makar Sankranti. Bye for now.